Let us pray. Almighty God, we beseech you to behold with your abundant favor and blessings as your servants whom you have been pleased to call to leadership positions in this republic. We seek guidance to treat and consider all matters that shall come under our deliberation in so just and faithful a manner as to advance the peace, prosperity, and welfare of our country and of those whose interests you have committed to our charge. Amen.
Order number 1, administration of oath. Order number 2, communication from the chair. Order number 3, messages. Order number 4, petitions. Order number 5, papers. Order number 6, notices of motion.
Leader of majority.
Mr. Speaker, I beg to move the following notice of motion. That aware that coronavirus disease, COVID-19, a new strain of coronaviruses that was discovered in December 2019, is an infectious disease known to cause respiratory infections ranging from common cold, fever, tiredness, aches, and pain to more severe health complications. Cognizant that this epidemic has no known cure and has spread and killed many people over several countries and continents, with the potential of affecting a large percentage of the world population as the impact of the virus is still unfolding. Further, cognizant that the World Health Organization has declared the coronavirus disease, COVID-19, as a pandemic. Aware that the government, upon confirmation of coronavirus cases in the country, has taken various measures aimed at containing the spread of the disease, including suspension of learning in all education institutions and need to minimize attendance to various gatherings, acknowledging that the Parliament building has high human traffic and has given working day, including Member of Parliament, staff, visitors, school children, visiting delegation, and witnesses appearing before the House committees, given the need for Parliament to institutionalize measures to mitigate the crisis posed by the virus, further cognizant the mechanism set out in Standing Order 30 to convene a special sitting of the Senate. Now, therefore, notwithstanding the resolution of the Senate made on 27th of February 2020, pursuant to Standing Order 29, approving the Senate calendar, and owing to the need to complement the efforts of the government in containing the spread of the disease, the Senate resolves to adjourn its plenary sittings today, 17th March 2020, to reconvene on Tuesday, 14th March 2020 at 2:30 p.m. and B, alter its calendar accordingly. Thank you, Mr. Speaker.
Next order.
Order number 7, statements.
All statements are deferred. Next, yes. Next statement.
Order number 8, motion, adjournment of the Senate in regard to COVID-19.
Leader of majority.
Mr. Speaker, I beg to move the following motion. That aware that the coronavirus disease, COVID-19, a new strain of coronavirus that was discovered in December 2019, is infectious disease that known to cause respiratory infections ranging from common cold, fever, tiredness, aches, and pains to the more severe health complications. Cognizant that this epidemic has no known cure and has spread and killed many people over several countries and continents, with the potential of affecting a large percentage of the world population as an impact of the virus is still unfolding. Further cognizant that the World Health Organization has declared the coronavirus disease, COVID-19, as a pandemic, aware that the government, upon confirmation of coronavirus cases in their country, has taken various measures aimed at containing the spread of the disease, including suspension of learning in all education institutions and the need to minimize attendance to various gatherings. Acknowledging that the Parliament building has high human traffic on any given working day, including members of Parliament, staff, visitors, school children, visiting delegation, and witnesses appearing before the House committees, given the need for Parliament to institutionalize measures to mitigate the crisis posed by the virus, further recognizing the mechanism set out in Standing Order 30 to convene a special sitting of the Senate. Now, therefore, notwithstanding the resolution of the Senate made on 27 February 2020, pursuant to Standing Order 29, approving the Senate calendar, and owing to the need to complement the efforts of the government in containing the spread of the disease, the Senate resolves to adjourn its plenary sittings today, 17 March 2020, and reconvene on Tuesday, 14th April 2020 at 2:30, and alter its calendar accordingly. Mr. Speaker, this is an extraordinary motion in extraordinary times, not just for this House, not for this country, but for the world. Mr. Speaker, for those of us who are Christians, we believe that the world is in the hands of God, and we believe that God, Mr. Speaker, takes care and knows the calendar of our lives. Mr. Speaker, the same extends to many faiths, including the Muslim faith and many others, Mr. Speaker. And even as we ponder through this COVID-19, Mr. Speaker, a novel disease or a type of strain of a virus, which is in the family of other coronaviruses, Mr. Speaker, we first of all start by saying that, Mr. Speaker, our faith, like the Constitution says, remains to be in God. And we believe that above all, above science, above human ability, God has ordered the steps of each one of us and the destiny of our lives, and that He takes care of our human bodies. And Mr. Speaker, we strongly believe that we are on this earth for a mission, for a purpose, for a certain particular period of time, and to serve God's purpose in the time that we live. And Mr. Speaker, this disease has scared the world in the manner in which it's been reported. It was initially thought that it was only China, that, Mr. Speaker, it was a problem within China. And there were a lot of myths about the cause, which are still there. The myths are there about the cause. People also thought that, Mr. Speaker, it was about the race, that it was only affecting Chinese, and it was not going to affect the other human races, Mr. Speaker. But you can see that this disease, having been discovered in December, has spread so fast that, Mr. Speaker, it is a clear definition of globalization and interconnectedness of human race. A very interesting observation to make is that, Mr. Speaker, it also shows that despite the development of the world, the parts which are more developed and those which are poorer, Mr. Speaker, despite the fact that some races see themselves superior than others, the reality is that we are all human beings and susceptible, Mr. Speaker, to many dangers that that are posed by different kind of things, whether because of environmental changes or matters related to health, as a virus in this matter is concerned. So, Mr. Speaker, it's inevitable that those of us who've been given responsibility of leadership must take steps, Mr. Speaker, to preserve and protect fellow human beings. Mr. Speaker, I was seeing, just to mention the question of interconnectedness of human beings, I was seeing an application. There's an application that, Mr. Speaker, shows how aeroplanes move in the world. And there's someone who took a picture of that application, Mr. Speaker, that shows, many parts of the world and says, see how coronavirus is moving. And Mr. Speaker, it's transported by human beings, moving from one continent to the other. And Mr. Speaker, today as a Senate, we must rise to the occasion to become part of the solution, Mr. Speaker, to protecting the movement of this virus from one person to another by ensuring that in the first instance, we curtail that movement. Mr. Speaker, the President, when he banned public meetings, when the Minister of Health banned public meetings pursuant to Public Health Act, Mr. Speaker, as allowed by the Public Health Act, he said we should ensure that we discourage a gathering of 50 people and above. This house, Mr. Speaker, is a gathering of 67 people. And Mr. Speaker, 68 actually, and also including staff who serve this house would go up to 70 to 80 at any given time. So as we ponder and think through how best we can respond to this virus, it's important, first of all, in the first instance, after Senate Business Committee sat under your leadership, a decision was made that, Mr. Speaker, in the first instance, we need to take a break for 1 month as we put in place mechanisms that will ensure that, Mr. Speaker, we are able to, when we come back, to be able to deal with this challenge in the manner in which we will operate, how we will relate, and, Mr. Speaker, how we are going to interact as senators. Mr. Speaker, since this disease has hit this country, there's been a lot of panic and fear. And, Mr. Speaker, a lot of questions. And I want to thank His Excellency the President for taking a bold step, Mr. Speaker, to close, Mr. Speaker, this country, visitors from other countries, Mr. Speaker, that are coming from countries that are severely affected and where this disease has been reported. I want also to thank the President for closing schools, Mr. Speaker. That is a bold decision, because some people would have said, let's wait for, it was my really considered opinion that we should have closed the gates of this country and the schools from the beginning and start now planning, Mr. Speaker, how we are going to react, train the teachers, train the managers of various institutions, how we are going to handle this issue. And I'm glad that that decision was taken, Mr. Speaker. But that decision is not without consequence. The, Mr. Speaker, discovery of that disease in this country is not without consequences. Mr. Speaker, there is going to be severe economic impact, Mr. Speaker. Mr. Speaker, in an article that was in New York Times on March 16th, which was titled, "Coronavirus Deepens Inequality. Inequality worsens with its spread." The author says, Mr. Speaker, and I quote, "Economic inequality itself may be acting as a multiplier on the coronavirus spread, Mr. Speaker, and its deadliness." Mr. Speaker, we are a struggling economy to start with, a developing country, working hard to see how we can deal with our economies. If you listen to United States of America, the President is already promising, Mr. Speaker, that he's going to take care of the needy, the people who are the poor. If you see how China reacted, Mr. Speaker, even when there was a lockdown in many of the cities, especially in one province, Mr. Speaker, there was a lot of effort to ensure that streets are sprayed, Mr. Speaker, disinfected, people are disinfected, Mr. Speaker. A lot of effort was spent in the terms of resources, Mr. Speaker, to deal with it. I'm wondering, Mr. Speaker, if we don't prevent this issue, how best are we going to deal with economic inequalities in this country? We must think what will happen to people who live in Kibra, Mr. Speaker, who live on Mr. Speaker, daily income. They go look for jobs, Mr. Speaker, in industrial area, and if they don't get that day, they don't have a meal. Mr. Speaker, what will happen to people in Madare slums, in Mukuru kwa Njenga, Mr. Speaker, Mukuru kwa Kayaba, Mr. Speaker, and all these other people who live in places like Kawangware, who live in Kangemi, Mr. Speaker. And, Mr. Speaker, many parts of the country, especially urban areas, and particularly urban areas, because if we don't contain this disease in Nairobi, Mr. Speaker, the spread will be worse in other parts of the country. And I hope, Mr. Speaker, the Nairobi County government, the national government in Nairobi, and all actors, including ourselves in this Nairobi, are going to contribute, Mr. Speaker, to blocking this disease from spreading fast. Because if it goes to places, crowded places, Mr. Speaker, like the slums, we are going to have a big problem. But then, there must be a contingency measure by the government. Mr. Speaker, because those people live on, Mr. Speaker, daily income, daily wages that they earn from working, Mr. Speaker, as laborers in construction sites or in factories. A lot now must be thought, Mr. Speaker, how to deliver food, Mr. Speaker, to those people where they live. Mr. Speaker, it will reach a stage, and I want to say this, it will reach a stage if we don't work very hard. Mr. Speaker, if the people in Kibra will not get food, the people in Karen and Langata, Mr. Speaker, will have to share food with them, either by choice or by force. So, Mr. Speaker, a contingency measure must be applied that will ensure that everybody is taken care of without looking at whether they are rich or they are poor, Mr. Speaker, because this is going to be a challenge that we are going to deal with. Mr. Speaker, this is one area that I think as senators, we must be able to give our views to the executive, to give our views to the county government, Mr. Speaker, on how best we can be able to achieve. But most importantly, if you are a senator like ourselves, and there are people who have been working for you, either in your farm, Mr. Speaker, or in your house, or wherever you live, or your neighbors, this is the time to extend generosity, because even though we get salaries, Mr. Speaker, there are many people who get nothing. And if they are told to stay home, Mr. Speaker, they are not going to have anything to earn. So if we are able, Mr. Speaker, to continue keeping certain people in employment, even when they are not actually working in our home states or in our farms or in our companies or in our private offices, Mr. Speaker, we must work very hard to ensure that we continue supporting these issues, Mr. Speaker. Number two, the President spoke about hoarding of, Mr. Speaker, commodities and hiking prices, Mr. Speaker, of these commodities and the panic buying that ensues, Mr. Speaker. And again, I want to quote Professor Nicole Everett, Mr. Speaker of University of Washington, who was quoted on this matter and said, public health isn't just about your own personal health. It's about the health of the public at large. Therefore, if one person cannot access hand sanitizers or water or soap or basic commodities, that person is not just posing risk to himself, but posing risk to everyone, including those who have stock of sanitizers and soap in their homes and retail stores. Mr. Speaker, as even we buy and, Mr. Speaker, hoard these products, and we are the ones who are supplying them, and we are the ones who are increasing the prices. Our hand sanitizer now of our 400 ml, Mr. Speaker, which was selling the other day for 200 shillings, is selling 800. Some places even 1,000, Mr. Speaker. I want to request, and Mr. Speaker, these business people to heed the advice of the President that, Mr. Speaker, let's not increase prices. Let's not wait. It's an act of patriotism. Let's not wait, Mr. Speaker, that there must be legal enforcement. This is a time that this country must come together. Everybody who has the ability to help his neighbor. If there is a time that we must heed what Jesus told, Mr. Speaker, said in the Bible about my neighbor, Mr. Speaker, we must, Mr. Speaker, take care of that person who depends on us. Like, Mr. Speaker, that neighbor of yours whom you have a duty of care, as Lord Atkins said, Mr. Speaker, in quoting the Bible, and in that, Mr. Speaker, any person who is closer to you, that perhaps your actions, Mr. Speaker, may lead to adverse impact to that person, we must be able to extend a hand. And, Mr. Speaker, I saw in CNN a story of a buyer who bought, Mr. Speaker, goods out of panic, all the sanitizers in his community. And, Mr. Speaker, after coming back to his conscience, he decided that he was going to donate for free to as many people as possible who need it, Mr. Speaker. This is a time of patriotism. This is a time, Mr. Speaker, that we must stand together to ensure that we assist those that need our support. Mr. Speaker, our economy is going to have severe impact. In Italy, Mr. Speaker, they have made certain determinations, Mr. Speaker, that have helped, that are intended to help, Mr. Speaker, the economy. To start with, Mr. Speaker, the government must think quickly on how to grant tax breaks to companies, especially small companies, so that, Mr. Speaker, they can continue operating, employ people, and continue supporting the economy. Mr. Speaker, banks must continue giving concessionary loans at low rates to small businesses. And Mr. Speaker, the enforcement, the forceful enforcement, Mr. Speaker, of repayment of loans could possibly have a discussion between central bank and the banks to suspend, so that, Mr. Speaker, most of these businesses that are now not operating, particularly those who are providing services, Mr. Speaker, that the service industry should be given a break so that then they can come and pay their loans later cumulatively. Mr. Speaker, we must think about how we are going to refund VATs and assist small businesses like it's been done in other parts of the world. All these efforts, Mr. Speaker, must be made to ensure that the economy continues to thrive even at this very difficult time, even as we think through how best we are coming back to continue assisting the members of public. Mr. Speaker, this pandemic, Mr. Speaker, is not easy. For all of us, Mr. Speaker, we pray that it doesn't affect all of us who are seated here, and we pray that it's minimized. The Cabinet Secretary is going to have a press conference shortly. You never know what he's going to tell the country. But, Mr. Speaker, we hope that we can contain it to levels that, Mr. Speaker, we will make sure that our health facilities are able to, Mr. Speaker, provide health services. Mr. Speaker, we have also responsibility to ensure we protect the old, Mr. Speaker, and those who have been sickly, Mr. Speaker, take deliberate steps to protect them, Mr. Speaker. Let's not sleep on the job. What scares me most is the statistics that is shared from countries like Italy, where, Mr. Speaker, for the first 1 week, almost the first 1 month, it was not more than 10 people. And then, Mr. Speaker, it began to spiral. A friend of mine who was in Milan, who is in Italy, Mr. Speaker, told a few of us, Mr. Speaker, that there was a leakage through a media house that there was going to be a lockout in Milan, Mr. Speaker, lockdown in Milan, completely, that people were not going to move. Then someone leaked that information. As a result of leaking that information, Mr. Speaker, people began to run from Milan to other parts of the country, driving, Mr. Speaker, move. Once that happened, Mr. Speaker, the catastrophe occurred in that country. I hope we are going to manage movement of people, even as children as they go home from today. Some have gone home from today from high schools. I hope the transport system is going to be, Mr. Speaker, managed in such a way that those who are transporting our children will, Mr. Speaker, observe the hygiene standards, take them home, so that we don't have a situation where one infected person in a bus or a matatu takes all this disease around the country. Mr. Speaker, whereas government must do something from the initial information that is available, it will require a lot to be done by individual citizens, Mr. Speaker, in terms of personal protection, in terms of personal commitment, in terms of, Mr. Speaker, protecting your neighbor and protecting the country. So what have we decided? We have decided as a House, through this motion, to, Mr. Speaker, break for 30 days. In those 30 days, what are we going to be doing, Mr. Speaker? We'll continue working on the work we have as committees, even if we are not meeting physically. The research will continue on the reports that we are supposed to deal with. Our staff will continue working, Mr. Speaker. We will continue through technology, as we have always done. Senators know we are always in consistent conversation, Mr. Speaker, on WhatsApp, Mr. Speaker, on telephones. We must continue engaging to find out how best we are going to contribute to certain, Mr. Speaker, solutions. We also, in this motion, we made it very clear that, Mr. Speaker, the Senate, Mr. Speaker, will be on standby. Every senator will be on standby. Should we need you to come back even tomorrow, if we adjourn today and we need senators tomorrow, Mr. Speaker, your office is open as the Speaker's office. My office is ready and open, and I'm going to quickly, Mr. Speaker, come up with a motion recalling senators, find all the senators that are here. Mr. Speaker, I want your office under Standing Order number 1 to, Mr. Speaker, decree that I will use electronic approvals, Mr. Speaker, using the necessary platforms, whether it's an email or, Mr. Speaker, WhatsApp messages, to approve the 15 people we require for you to gazette, Mr. Speaker, and we come back. We do not need to be stringent, Mr. Speaker, that we must see each other face to face to sign for our coming. We can use technology, Mr. Speaker, to proceed with, Mr. Speaker, convening this House. And once we come here, we will make the decision that, Mr. Speaker, is necessary for us to take our country forward. Mr. Speaker, we must also keep in mind that we cannot sleep on this matter because we are not coming back after a month so that we break. We must put measures in place that when we come back within the next 1 month, we will continue working and work, Mr. Speaker, in the circumstance that we all know it's not necessarily easy to imagine now that within 1 month we'll have solved this problem. Mr. Speaker, we know very well United States reported, started, a company in US in the state of Washington, started trials for a vaccine on this issue, Mr. Speaker, and they have said it will take up to 18 months to possibly get a proper vaccine that may be able to solve this problem. So meaning, in the next 18 months to 2 years, Mr. Speaker, we are probably, it may even be 2.5 years, it might be to the next general elections. Mr. Speaker, we are probably going to be handling a situation where social contact, Mr. Speaker, will have to be dealt with. So we will come back in a month and ask ourselves, how will we continue public engagement with our voters? How will we continue our public meetings with our citizens? Mr. Speaker, Governor Oparanya yesterday announced that in Kakamega that, Mr. Speaker, now, because funerals are part of public gatherings, and Mr. Speaker, because of space also in the mortuaries and handling of bodies and crowding of people, that burials will be confined to family members and must be done immediately without waiting for a longer period of time. It might change completely. I saw the Prime Minister of UK saying, it is unbelievable that in time of peace, human life and human contact is going to be changed completely, Mr. Speaker. So we must go thinking and come back after a month. It may even require that we have a law. We might require a law, Mr. Speaker, to determine what you do with a person who will, Mr. Speaker, want to deliberately spread such a virus. Or, Mr. Speaker, after finding out that he might be having this virus, hide from the authorities and then make it difficult for us to establish, Mr. Speaker, who is the next person, who are the next people who may need our help. There are a lot of things that may require the law, it may require policy, it may require just giving ideas to the executive at the national and county level to take this country forward. This is the time for cooperating together. I said, Mr. Speaker, it's not a time for taunting each other. It's not a time, Mr. Speaker, for spreading myths. It's not also the time for spreading fear. Mr. Speaker, this is a time, if you are a leader, someone said a leader is a dealer in hope. Our responsibility now is not to continue telling people we might die or we are going to die by tomorrow. We must spread hope. Human race has been faced by similar challenges, Mr. Speaker, whether the first time, Mr. Speaker, people were dealing with smallpox, Mr. Speaker. People are dealing with SARS, Mr. Speaker, in Asia just the other day in our lifetime. So it's us as leaders to say, we'll find a solution, we'll find ways of cooperating together. We must not fear, but we must be careful to ensure that we take this country forward. Mr. Speaker, with those many remarks, I beg to move this motion and request the Senate Minority Leader, Senator James Orengo, to second. Mr. Speaker, sorry. I request the Senate Deputy Minority Leader, Senator Cleopas Malala, to second.
Thank you.
Senator Malala.
Thank you, Mr. Speaker. Mr. Speaker, I stand here to vehemently support and second passionately support this motion and second it, Mr. Speaker. Mr. Speaker, I'm not only supporting this motion because we want to adjourn this House, but I am supporting this motion because this is a time of need as a country. We need to reflect on our level of preparedness as a country. Mr. Speaker, I want to be more specific on our level of preparedness at the county level, Mr. Speaker. As we adjourn this House, it is important that as honorable members of this House who are mandated to represent counties, to retreat to our respective counties and ensure that we have high levels of preparedness at the county level, Mr. Speaker. Mr. Speaker, yesterday I had an opportunity to do an impromptu visit at the Kakamega General Hospital just to ascertain their level of preparedness. Mr. Speaker, we have seen county governments trying to come up with isolation centers. In Kakamega, I want to confirm that Kakamega County General Hospital has an isolation center, but the big question is, we are focusing on county referral hospital or level 4 hospitals. What about level 3 hospitals? What about level 2 hospitals, Mr. Speaker? Mr. Speaker, the level of preparedness must trickle down to the primary health care facilities at the grassroots, Mr. Speaker. Mr. Speaker, I'm afraid that cases, the first line that will interact with the cases of corona will be at grassroots level, Mr. Speaker. And therefore, it is important, Mr. Speaker, as we prepare to handle these menace, Mr. Speaker, we prepare at grassroots level. Mr. Speaker, apart from the room that have been set aside to isolate patients of corona, in Kakamega, we've not seen the national government bringing enough equipment to facilitate the treatment of coronavirus, Mr. Speaker. Mr. Speaker, as per yesterday, a whole county, we had only received 10 PPEs. Those are the personal protection equipment. So it surprises me, Mr. Speaker, that in a whole country where we have more than 100 facilities, we only have 10 PPEs, Mr. Speaker. And therefore, it is important, Mr. Speaker, as the national government tries to curb this menace, Mr. Speaker, let them do it at grassroots level, Mr. Speaker. Mr. Speaker, we need to be told what type of medicine is used to treat corona, Mr. Speaker. Do we have the same medicine in Kenya? If we do not have, what are we doing to ensure that we have that medicine? Because just isolating a patient is not enough, Mr. Speaker. Mr. Speaker, I was told that the medicine that treats corona has a component of chloroquine, Mr. Speaker. Mr. Speaker, chloroquine, the last time chloroquine was manufactured in Kenya was in 2012, Mr. Speaker. And therefore, these are the questions we should be asking the current establishment as to whether we are ready and genuinely ready in fighting these coronavirus. The first people we should protect, Mr. Speaker, are the health workers. Yesterday, during my visit at the Kakamega General Hospital, I realized that the health workers at the casualty do not have protective gear. These people are at risk, Mr. Speaker. Mr. Speaker, the community health volunteers at grassroots level do not have protective gears, Mr. Speaker. It is the responsibility of the national government and the county governments, because health is a devolved function, Mr. Speaker, to ensure that the health workers have enough equipment to protect them, Mr. Speaker. Mr. Speaker, when it comes to the issue of dissemination of relevant information to our people, Mr. Speaker. Mr. Speaker, I was having a chat with one of the doctors in Kakamega and nurses, Mr. Speaker. They do not have information. They have not been trained on how they are going to handle such cases, Mr. Speaker. Yesterday, we had a boda man in Kakamega who got into the hospital and said that he has been coughing for a while and he has a fever, and he even tried to cough. And all doctors ran because they did not know how to treat such a case, Mr. Speaker. And therefore, Mr. Speaker, it is very important for us to have a central place where information will be disseminated, and a central place where we shall derive authority and as pertains to what we are supposed to do to curb this disease, Mr. Speaker. Mr. Speaker, we have seen governors, different governors issuing out different decrees. In Kakamega, Kakamega governor says that all mortuaries are closed, but our neighbors are still operating their mortuaries. This simply means that if somebody dies in Kakamega, he'll be taken to Vihiga County, because Vihiga still operates their mortuaries, Mr. Speaker. Mr. Speaker, we saw in Mombasa, the governor for Mombasa said that all discos and nightclubs should be closed. But his counterpart in Kilifi, just across Shimolatewa in Mtwapa, has said that discos will continue operating. So Mombasa residents will be going to Kilifi in the evening, Mr. Speaker. And therefore, this calls for a centralized point where we shall be getting information, Mr. Speaker. I want to encourage the governors, Mr. Speaker. Let them not start coming up with decrees that do not conform to the fight against coronavirus. Let us not contradict each other. Let us get information from the central committee formed by the President, Mr. Speaker. Mr. Speaker, I want to ask our governors not to take advantage of this situation, Mr. Speaker, and start spending anyhow, and start using government money anyhow in the name of curbing corona, Mr. Speaker. Mr. Speaker, we've seen governors who have started saying that they want to procure tanks within 2 days. Let them be put on notice that as senators, we're still watching them, and they will still be accountable. Any procurement that is done right now must follow the procurement rules that are set in the Public Procurement Act, Mr. Speaker. Mr. Speaker, we have seen business entities wanting to take advantage of this situation, increasing the cost of essentials, non-pharmaceuticals, sanitizers, even water, soap. Mr. Speaker, it is my humble submission that the national government should have a price controlling mechanism so that we standardize, especially the essentials that are needed to fight coronavirus, Mr. Speaker. Mr. Speaker, we have got some gadgets which cannot be found in the market right now, Mr. Speaker. The gun thermometers, Mr. Speaker. We are unable to even purchase the gun thermometers. The masks are not in the pharmacies, Mr. Speaker. And therefore, it is the responsibility of government to ensure that they procure and supply the relevant equipment that is supposed to fight this disease, Mr. Speaker. Mr. Speaker, the big question is, when I got into Parliament today, I was received by an officer, police officer, who was using the gun thermometer. I don't know if he has any medical background to ascertain whether somebody is sick or not, Mr. Speaker. Mr. Speaker, if we need to be serious, Mr. Speaker, let us have people who are qualified, people who can interpret, Mr. Speaker, issues of health, Mr. Speaker. But the big question is, here in Parliament and in privileged positions and institutions, Mr. Speaker, we have the facilities. Everywhere you go in the corridors, you are met by an officer giving you sanitizer. Honorable Mutula Kilonzo has been working with 2 sanitizers since morning. Mr. Speaker, I appreciate the fact that we are privileged. But what about that common mwananchi in the village, Mr. Speaker? Do they know the essence of the sanitizer? Do they have the privilege of accessing the sanitizers, Mr. Speaker? Mr. Speaker, it is therefore my humble submission that let the county governments ensure that the villagers, the common mwananchi at the village level, access the use of sanitizers and any equipment that will help them stay away from this virus, Mr. Speaker. Mr. Speaker, we need to suspend some of the existing rules, Mr. Speaker, that we have, especially the NTSA rules, Mr. Speaker. Mr. Speaker, the NTSA is very clear that when you are boarding a border, you must put on a helmet, Mr. Speaker. Mr. Speaker, in Kakamega, we have a crisis there because people cannot share helmets right now, Mr. Speaker. Because if you share that helmet, Mr. Speaker, automatically if somebody who has coronavirus is is using the same helmet, Mr. Speaker, the virus will automatically, you'll automatically be infected by the virus, Mr. Speaker. And therefore, it is important for us to look deep into these issues. But this should not create any panic, Mr. Speaker, because I believe that we pray a living God. And all our problems as a country, if we direct them on the cross of Calvary, Mr. Speaker, I want to believe that even this coronavirus will die before it gets to Kenya, Mr. Speaker. I'm told that already we have 3 cases which have been identified, Mr. Speaker, but I want to believe that that is the end of coronavirus. It will end at those 3 patients, and I want to wish them quick recovery. I want to assure them that we stand with them as a country, and we are praying with them. So, Mr. Speaker, I want to take this opportunity to once again say that I passionately support this motion to adjourn so that we retreat back to our constituencies, Mr. Speaker, and be with our people. Mr. Speaker, I am one person who was affected by the issue of saying that people should be buried immediately they die, Mr. Speaker. Mr. Speaker, we shouldn't allow this situation to take advantage of, we shouldn't allow this situation to deteriorate our cultural fabric, Mr. Speaker. Mr. Speaker, in Western Province, we believe that when somebody dies, we must mourn him. Let us put enough measures, Mr. Speaker, to allow people to continue living the way they've been living. Let life not stop, Mr. Speaker. So, Mr. Speaker, I want to support this motion that we should go for recess. But when we come back, Mr. Speaker, let us adjust our calendar, Mr. Speaker, because I am aware that when we come back, we are again supposed to go on recess, Mr. Speaker. I will be suggesting, Mr. Speaker, that when we come back, let us amend the calendar of the Senate so that, Mr. Speaker, when we come back, we save the time that we have lost during this abrupt recess. Thank you, and may God bless you. I started by saying I second. I beg to second.
Okay, honorable senators, I now propose the question, which is that aware that coronavirus disease, COVID-19, a new strain of coronaviruses that was discovered in December 2019 is an infectious disease known to cause respiratory infections ranging from common cold, fever, tiredness, aches, and pains to more severe health complications. Cognizant that this epidemic has no known cure and has spread and killed many people over several countries and continents, with the potential of affecting a large percentage of the world population as the impact of the virus is still unfolding. Further, cognizant that the World Health Organization has declared the coronavirus disease, COVID-19, as an epidemic, aware that the government, upon confirmation of coronavirus cases in the country, has taken various measures aimed at containing the spread of the disease, including suspension of learning in all education institutions and the need to minimize attendance to various gatherings. Acknowledging that Parliament building has high human traffic on any given working day, including members of Parliament, staff, visitors, school children, visiting delegations, and witnesses appearing before the House committees, given the need for Parliament to institutionalize measures to mitigate the crisis posed by the virus, further recognizing the mechanism set out in Standing Order 30 to convene a special sitting of the Senate. Now, therefore, notwithstanding the resolutions of the Senate made on 27th February 2020, pursuant to Standing Order 29 approving the Senate calendar, and owing to the need to complement the efforts of the government in containing the spread of the disease, the Senate resolves to adjourn its plenary sittings today, 17th March 2020, to reconvene on Tuesday, 14th April 2020 at 2:30, and B, alter its calendar accordingly. Senator Langat.
Thank you, Mr. Speaker, for also giving me this opportunity to support strongly this particular motion on adjournment of the Senate. Yes, Mr. Speaker, I support it because, one, most of the social institutions, including education institutions, secondary schools and universities have closed, and therefore, to show solidarity on this.
I will give you 5 minutes, those who will speak, so that we don't stay together for too long. Senator Lagat, you must leave here as quickly as possible.
Thank you very much. So to show solidarity as leaders, Mr. Speaker, it's very important that we adjourn and it be also public and people will see the seriousness of our participation in actually controlling this particular very pandemic coronavirus. Secondly, Mr. Speaker, sir, that this is a house also that consists of members who widely travel all over the world. Remember, some 2 weeks ago, we had gone to a country called Germany, and there were a lot of fears. And when we arrived, even our colleagues were feeling insecure. And therefore, even some few minutes ago, when I coughed, Murkomen almost ran out of the house. So I believe that also, to make us feel secured, it is very important that we reinforce on this particular adjournment as also a social house. Thirdly, Mr. Speaker, so I would like to say that as leaders, we shall also be there in the village sometimes to give our statements over the local radios and assure our people of good hope and the measures that the government has put in place to make sure that this particular coronavirus is put in control. And I want to say, Mr. Speaker, that there are a lot of rumors, and I'm so sure if we continue, some people might think that, you know, already in social media, some people are saying there is no coronavirus in this country. They are thinking that's a strategy for us to win sympathy and some funds outside the country. But I believe that even adjourning this particular house will also assure them that all of us are serious and coronavirus is serious. So I would like to support this particular motion, Mr. Speaker, sir, and say that the government also should come strongly to teach the public through the radios, television, and the rest. Because I was seeing over the Citizen TV when there was some presentations by some 2 virologists, there was so many controversials. So I would also say that the government should come up seriously to protect the citizen from wrong information. Some people are saying now the masks that are all over the markets cannot even prevent. Some are saying those masks are fake, and the public is under the mercies of the government to support them. So I would like to support strongly this adjournment of the motion so that we get to the villages there and also support our people in getting the knowledge on the same. Thank you, Mr. Speaker.
Senator Junior, Tula.
Thank you, Speaker. I support the motion. Mr. Speaker, it's obvious that we're in a crisis, 1. 2, it's obvious that we have not taken enough measures. I saw the Cabinet Secretary yesterday, Ambassador Macharia, surprised that our matatus don't have sanitizers, our matatus are not clean. I realize, Mr. Speaker, Corona makes us equal, has no equal. We are going to realize that we are the same as those people who use matatus, and we are not safe, even those of us who live in big mansions, because the people who work for us come from slums or other places. Mr. Speaker, I was wondering whether, and Senator Sakaja and I proposed a framework for disaster management. Mr. Speaker, it's obvious that from the reactions I've seen that we do not have emergency protocols. We don't have disaster management. I've not seen Parliament in the stakeholders committee. We are not sure whether we have enough money to handle this issue if this happens. It was pleasant to see that one of the footballers, I can't remember now, Ronaldo, offered his hotel because it's obvious. If, Mr. Speaker, if this virus extends to what it has done in Italy, we don't have enough hospitals. We don't have enough hospital beds. Should we convert some hotels and spaces to hospitals and hospital beds? Is it possible that government, instead of asking why there are no sanitizers, to tell us where the sanitizers have gone? Isn't it possible for the National Committee to, in fact, convert the money that was supposed to be for travel by Parliament executive to buy sanitizers all over? Senator Murkomen sent us a clip of a Kamba lady calling Corona cologne. And she says, where is this cologne? We don't have masks. We have not even seen a medical officer. The people and this morning when I was going to work, I saw thousands and thousands of Kenyans walking to work. Now, all of us can retreat to our homes. It's possible that all of you have gone to supermarkets and exhausted the shelves by buying whatever you can buy, including tissue. Just think about the people who are from Mathare. We shut down for a day, they cannot eat. When you tell them not to shake hands, not to sanitize or clean their hands, if you go to Kibera where they have the Mama Kadogo economy, the money that you collect every day, you go and buy a chapati and something to eat. Every day. Mr. Speaker, wouldn't it be nice to see the National Executive Committee in our slums giving assurances? I would be happy, in fact, to see the Beyond Zero campaign trucks in all over the place, because you will need the equipment if something happens there. There will be no time and there will be no space for Mbagathi Hospital to take everybody when they fall ill. Mr. Speaker, I would have loved to hear that even members of parliament have been tested. A doctor sent me a clip, a small little picture of some equipment that costs about 19 rand. That is a self-testing equipment that should have been available in Kenya, because the tests that are being done in Kenya today are taking too long, Mr. Speaker, for somebody who is normal now, but is carrying the virus. We have so many carriers. I'm just concerned, Mr. Speaker, and I would like to hear from this committee that we can get this equipment so that people can do their testing all over the country. I know Cleophas Malala is saying that people should continue with their funerals in those large gatherings where we are singing Mwana Veri Boyaye, those things. But please think about the concern. No, it's not a funeral song, but it's a song, a traditional song. Mr. Speaker, this situation, Mr. Speaker, for those who have quoted the Bible, allow me to quote 2 Chronicles chapter 5, verse 17. Chapter 7, verse 13 to 14. I shout up to the heavens so that there is no rain. If I command the locust swarms to eat up all your crops, or if I send an epidemic to you, then the people will humble themselves and pray and search for me and turn from their wicked ways. I will hear them from heaven and forgive their sins and heal their land. This country needs to pray for all the corruption, all the tribalism, all the division, all the marginalization that we have been preaching. Mr. Speaker, this country must pray and turn from their wicked ways. Thank you.
Senator Ali Abdullahi.
Thank you, Mr. Speaker. I wish also to support the motion of adjournment. Mr. Speaker, the Committee of Health, we had a statement, but because of your order, which was about corona, we could not read it. And also there was a statement from the Minister of Health concerning the same. But all said, I think the Minister will do his part and we'll do ours. Mr. Speaker, sir, when it comes, people like quoting religion. All religions more or less are the same. And for the Muslims, we also have issues about when infectious diseases come up, you quarantine yourself, and quarantine is allowed. Mr. Speaker, when you see the churches and you see the mosques, you get worried. Especially in the mosques, people pray on mats, and you know how you spread this thing. It's not even because of sneezing or this, but when somebody sneezes and you come and put your hands on the mat, you are going to get infected. So I want to urge the Muslim community to try and make sure that at least it's not like the way they are doing in Kuwait, that they sit 1 meter apart, but to make sure that those mats are clean, they are sanitized proper, so that after every prayers, they're able to clean it so that you don't get infected by going to the mosque, Mr. Speaker. The other issue is about the health workers, the police officers, the ambulance drivers. I think these are emergency people, and these emergency cases, first case like the ambulance drivers, the police, because when there's problem, they are also informed. And even the chiefs at the rural areas, these people should be taught properly what is expected of them so that our community is enlightened more. As Honorable Junior was saying, I also saw that clip, and it's shocking. And many people believe that, Mr. Speaker. Many Kenyans who are in the rural areas and in the slums feel this is not serious. So the government, whether it's the county or the national government, especially in Nairobi, as it has been stated before, the national government has taken over the health function. They should send health workers to all the, to Kibera, to Kawangware, to Majengo, to Ukuru Kwajenga, all these slums, Kariobangi, and tell them what is expected of them. At least, we are talking of handshakes. We know handshakes can cause the spread of the virus. What about exchange of money? What about exchange of utensils? What about borrowing things from one another? Mr. Speaker, things are not that easy in those areas. So we need proper education, and the only thing which can save us is proper education, Mr. Speaker. The use of the masks and gloves. Masks are supposed to be for those infected, Mr. Speaker. Literally, this is what people have to know. You can even infect yourself if you are not sick and you are carrying a mask. Because if somebody next to you sneezes on that mask, okay, or you touch somewhere. People walk around, they sneeze on their hands, and they touch vehicles, they touch walls, they touch everything. They touch seats like this. You go touching those places, and then you infect yourself. So the mask is not going to help you. So don't just say that mask. That's not the issue, Mr. Speaker. What is important is that you make sure where you touch, what you do, okay? You talk of your vehicle, you talk of your house. Somebody comes from Kibera, comes with a matatu, as you say. You don't want to help those people. They come there all over your house, touching everywhere. You go touching the same places, you get infected. So we have to think more than ourselves. Let's think of the people. Let's think of what we can do in these slums where there are hundreds and thousands of people aggregated in small areas, in small kiosks. How are you going to stop some of these things? The government and the national, whatever steering committee has to think of how they can do public education. The most important thing is public participation and public education so that we know what is really happening, Mr. Speaker. The others you see, guys, people are having, like in banks, some banks, gloves. These surgical gloves, okay? You can even infect yourself with that. I bring you money, and I'm infected. You do this, later you touch your nose, you do this, you don't even think about it. You touch your face. You saw that minister in the US, what she was doing. She was saying, she was reading a statement, and she was fingering her nose and touching her nose. These are things you can't help. Majima Weta calls me Italiani, you know, the Italian. You touch here, you touch here, you touch here. A lot of things can happen. So people.
Okay, you have run out of time. People are not touching themselves. I'm sure. Leader of minority.
Thank you, Mr. Speaker. I rise to support this motion. Mr. Speaker, there have been many pandemics in history. And in fact, this pandemic may be confirming the saying that history repeats itself. And Mr. Speaker, you may be aware that sometime in the 14th century, there was a pandemic known as the Black Death, or the bubonic plague. What was unique about this pandemic in the 14th century is that it started where this one started and peaked where this one is likely to peak, and that is in Europe. And at that time, when it peaked in the middle of the 14th century, more than 75 to 200 million died in Europe. And if you look at the figures now, or the reported cases, the numbers that are being recorded for European countries are very large. In fact, if you compare to African countries, ours, one may suggest that it is insignificant. So this pandemic, as it was then, as it is now, knows no borders. In fact, some of the most powerful and the richest countries are recording some of the highest cases. There are cases reported in all the countries which belong to the 5 permanent members of the Security Council, the UK, the US, China, Russia, and France, and even some of the richest countries, some of them who belong to the United Nations Security Council, like Japan, have also recorded cases. And as somebody has said before, it does not discriminate poor or rich. And you have seen some of the celebrities, best-known celebrities and leaders in the world have tested positive. Mr. Speaker, again, talking about this on from a historical dimension, I can say that probably more than any other time, the South, I'm basically talking about the Third World and Africa, we were not as intensively hit as some of these countries of the First World. But that does not mean that we should not take cognizance of the fact that the spread is universal, and the spread has a degree of intensity which we cannot deal with effectively. But I hope that with time and as we learn, this pandemic is going to be dealt with, effectively. I want just to repeat what was said earlier by one or two of my colleagues. In China, some of the doctors who first dealt with this pandemic in the city of Wuhan, and the nurses, tested positive eventually, and some of them died. Even in the United States and some places in Europe, these health workers, nurses, first responders have met with the tragedy of either suffering from the virus or eventually dying. So I would plead, like the other members who have done before, as a matter of emphasis, that the government needs to do a lot in preparing the people who are going to take care of us, the health workers. Because as we speak now, I don't think there's sufficient training, sufficient equipment going to health workers, either in Nairobi or in the counties. And the world is reacting very positively. This great Chinese investor has given donations of equipment to all the African countries. And I think this should first of all go to the health workers. And it's like going into, when you board a plane and you're taken through the security protocol, you're told before you mind your child, you tie your seatbelt first, and then you can tie that one with your minor sitting next to you. So equally, I think something should be done to the health workers to make sure that they are prepared and they have the right equipment. The same thing happened with a lot of doctors who sacrificed in dealing with a plague like, or pandemic like Ebola. Some of them paid with their lives. So I think this should be done. Now, testing. I also believe that there's no sufficient testing taking place in Kenya. In Korea, South Korea, the cases are up because the testing is almost universal. In every workplace, in churches. I didn't know there were so many churches in South Korea, but this pandemic has brought out the fact that they actually manage churches in South Korea. And it is some of these churches actually who have been more responsible for the spread of the pandemic in South Korea. And so far, the government is doing its best, giving the public information, giving regular updates. But I think when you go down to the counties, the same kind of initiative is not being reflected in the counties, except one or two who have made statements which I think are commendable. And I think we have to be, at a personal level, be very careful. You have seen in certain instances where even head of governments and heads of state have to practice social distance, separated from their families, and live in isolation. So I think it's the right decision to make. If you look at what has happened in Iran, in the UK, the House of Commons, in the United States, parliaments are not immune. In fact, the highest number of cases reported in parliaments, I think, has been, as we speak now, is Iran. But it may catch up with us. So I think that 30 days will give us time to take stock of what is happening in the country. And even amongst ourselves, we've got to practice social distance to make sure that when we reconvene, each one of us would have gone through the rigmarole of testing and so on. But hope, like the majority leader said, that the government, as it deals with the pandemic, what are the interventions that are going to be made to make sure that the economy is not brought down by this pandemic? Some interventions must be made to make the life of citizens not as difficult as is being experienced in some areas. So I hope that these interventions are going to be made because it's now not just a health disaster or emergency, but I think the economy is going to be affected, learning is affected, and all spheres of life have been affected. But I think we should not spread fear. Life should continue, and we should continue to work hard and make sure that during this period we don't crash. I know we have stopped gatherings, funerals, churches, even BBI, the rallies have stopped. But the reggae has not stopped. But you know where the reggae music is found, so that one has not stopped. But Harambes definitely have stopped. So, Mr. Speaker, finally, I think we should be ready at any moment, has been recognized in the motion, that Parliament should be able to be recalled any time. Because at the time when there is an emergency, we should never have a situation, and in the context of our Constitution where the Parliament has a role throughout, whether it is wartime. And one of the things that happened in making this new Constitution was that Parliament is never dissolved. It is one Parliament leading to another. There should never be a gap. So at any given time, there is always a Parliament in place. Just like at any given time, there will always be a head of state, whether he's acting or not, or a president, whether he's acting or not. So Parliament also, in the wisdom of the makers of this Constitution, ensured that Parliament will never be dissolved. Or just a question of one Parliament handing over to another parliament. So I think the context of this motion has set it out very clearly that there's a mechanism to recall parliament when there is need. And Mr. Speaker, that need should not only come when there is a disaster. To show leadership, we can also be called when facts unravel and we find there is a basis for recalling parliament and giving guidance to the executive and to the nation as a whole. You know that the executive, either in terms of the national executive or the county executives, you know, sometimes a lot of tragedies and problems we go through are caused from those two sources. So Parliament should be at the door every time, even if we are having a recess. And with those remarks, because I know a lot of people want to contribute to this, I support the motion.
Senator Farihia.
Thank you, Mr. Speaker, for giving me opportunity to contribute to this motion. Mr. Speaker, I support this motion, the adjournment motion, but I thought we should have handled this better slightly. I have a different view, and I think some of the senators yesterday also said the same thing. I wish we could be coming at least every Tuesday to address new issues as they arise, but not complete shut in terms of given that this is a health issue, and given that health is devolved. So this House has much more responsibility as a House in terms of how this moves forward. And as the majority leader has rightly said, we might even need to have a legislation in terms of, different other issues as they arise. Mr. Speaker, I believe in any disaster, sometimes there are opportunities as well in those disasters. Because, Mr. Speaker, at the rate the environmental pollution was going on in this world, I think this break that has, factories slowing down, flights being slowed down, I think will have a meaningful impact in terms of environmental, it will impact positively to the environment of the world, Mr. Speaker, because we have become so greedy as human race that we didn't care how much we are polluting our rivers, how much we are polluting the skies, how much we are polluting everywhere at the detriment of our lives and our future on this earth. So, Mr. Speaker, as much as I am not in support in the way it came, but at least there is a relief to the environment in terms of this pandemic, Mr. Speaker. Mr. Speaker, the other thing is that, as you're aware, this pandemic has a very big impact in terms of the economy of the world. And Mr. Speaker, I was hoping to bring a statement to that effect, but now that we are adjourning, I will not have that opportunity. So I wanted to also use this opportunity to address it. Mr. Speaker, according to the International Finance Institute, they have warned that the world economy will drop. The global economic growth will drop to 1% as compared to 2.6% similar period, Mr. Speaker. As a result of that, countries that are developing or emerging economies, Mr. Speaker, will be challenged in terms of repayment of their debts, Mr. Speaker, in terms of because you can only generate revenue when you're productive. In terms of the lockdown that we are currently experiencing partially, or maybe total lockdown that we anticipate in case this pandemic continues to the next level, Mr. Speaker, our ability to service external debt by our government will be impacted. So, Mr. Speaker, it would have been good if this House would have, this House, we would have written to the Ministry of Finance or Central Bank of Kenya in terms of, requesting a grace period during this time, and as well as also, holding, interest, because as interest continues accumulating, then as much as, this pandemic will kill some people probably, or we will get over it and without touching us. But at the end of the day, if we become bankrupt, maybe poverty will kill much more people than the pandemic itself. So there's a lot of impact in this because of this coronavirus. And Mr. Speaker, it would have been very, the way I feel is that it would have been better if we were there to ensure that at least we keep on, abreast ourselves to the issues, and then we congregate every Tuesday, and then we debate so that we at least we give solution instead of all of us shutting down and becoming part of the panic that we don't want people to panic the way this is a serious threat. I'm not belittling the threat, but I think the panic will have reduced if we were there to speak to issues. And then look at the airlines as well, Mr. Speaker. We
The time out, Senator Moses Wetangula.
Thank you, Mr. Speaker. Mr. Speaker, you should have told Senator Mutula Kilonzo that Mwanawambere is not a funeral song. The funeral song is called Luwele. Mwanawambere is for birthdays and weddings. Mr. Speaker, I would also have thought differently. We are three arms of government. The judiciary has not closed down, it has scaled down. The executive has not closed down. Cabinet is meeting, giving the country direction, giving the country hope. I think, Mr. Speaker, that this is a wrong decision we are making. This House should not close. This House should probably scale down our sittings, but continuously monitor the situation, hold the executive to account by members raising issues on this floor. What measures are we taking? What have we done? What resources have we committed? And so on and so forth. That is the way we should be helping the country, Mr. Speaker. But this House and the other House closing down and going home is actually a cowardly act. And we should not do that. We are actually absconding our duty. Mr. Speaker, this House should be summoning ministers where we find situations necessary to summon them to find out what is happening. Because we have a high risk, Mr. Speaker, of the government concentrating about coronavirus in Nairobi and forgetting that there could be corona in Mandera, there could be corona in Moyale, in Bungoma, in Siaya, everywhere. So, Mr. Speaker, I want to urge, because it looks like the majority will want to vote for adjournment, but my view is it's wrong. We shouldn't have done this. We should have remained here. But as we do so, Mr. Speaker, I want us to urge the national government that the people who are really affected by this close down of the country is not parliament, is not the judiciary, is the ordinary man and woman in Gorogosho who walks to Mjengo every day to come back with 200 shillings to buy food and put on the table. Can the government consider, Mr. Speaker, immediately giving food rations to Wananchi, particularly those who live in slums, who have no farms, who rely on their natural toiling and moiling at construction sites, or standing all over the places looking for something to do. Somebody with 11 children has to earn 200 shillings to come back with a packet of unga. Can we give them food rations, Mr. Speaker? Thirdly, Mr. Speaker, like others have said, we don't seem to have sufficient capacity to test and verify who is sick, who isn't. And as a result, social media hooligans have joined in, Mr. Speaker, with fake news, with all manner of stories. I'm happy that 2 or 3 guys were arrested in Kitui the other day for spreading fake news about who is infected and who isn't. But more importantly, Mr. Speaker, this country has already had very serious economic problems. Now we are shutting down. I want you as the Speaker to also give us direction on what we are going to do. For example, this is the budget season. Some of the issues we deal with in budgeting are constitutionally time-bound, and timelines are set. Now that we are going away, do we have the capacity to expand the constitutional timelines? I opine we don't. I also want to urge, Mr. Speaker, my chairman is here, the Committee for Mess. You gave us a third-day extension last week. Does the clock stop ticking with this adjournment, or we shall come back and move yet another motion to expand the time of the committee? Thirdly, Mr. Speaker, we have got the committee that is so important in oversight in counties, CPAC. Are they going to close down, or they continue doing their work so that they can be able to keep abreast with the audits of the counties? And more importantly, Mr. Speaker, I think that, and I want to urge members, if you agree with me, this motion should not be accepted. If we want to amend it, let's amend it to say, instead of sitting on Tuesday, Wednesday, and Thursday, we shall be sitting maybe or every Wednesday to give members time and a platform to raise pertinent issues affecting the country at this difficult time. We will be helping the president, we will be helping the government, we will be helping the people we represent. But locking ourselves away and going home is not going to help at all, at all, at all. Majority Leader, think twice about this. You spoke very well about adjournment, but you must also see the other side of the coin as to whether it is necessary or not. It isn't necessary. Thank you.
Senator Ochila Yako. He has an amendment. I think he has an amendment to the motion.
Thank you, Mr. Speaker. Mr. Speaker, I have an amendment to this motion, and allow me to move it. Mr. Speaker, sir, I beg to move the following amendment to the motion: that the motion be amended by deleting paragraph A and substituting, therefore, the following new paragraph A. Adjourn its plenary sitting today, 17th March 2020, for 2 weeks, so as to reconvene on Tuesday, 31st March 2020, and thereafter hold one sitting in each week. Now, Mr. Speaker, this, in my view, is the compromise, and it's important. I believe that we need 2 weeks to be able to put in place systems that would protect members of parliament and the staff the scaled down staff that we might need to perform our functions. So if we go away for 2 weeks, I believe if there are certain things that we need to procure as an institution, that is sufficient time to do so. It is also sufficient time to pass information to our staff, both in our county offices and in our offices here, so that they may also scale down their activities. But the need to be appearing every week, Mr. Speaker, it is very sad that the pieces of information we receive as an institution, we get it from the social media. We get it from grapevine and from rumors. As an institution and as institutional individuals, we are responsible to people who elected us. It would be very tragic for senior senator like James Orengo, like Murkomen, like Moses Wetangula, to be sharing rumors with his constituents. It is important that information that emanates from senators must come from government in its official capacity. So as we meet once a week, we will be expecting responsible people in government to come and tell us the status of the spread and what measures are being taken to deal with it. And we will also be giving them feedback as to the status of the safety of our constituents or our county people. So, Mr. Speaker, it is important to ensure that we meet once a week so that we receive official information. Mr. Speaker, one other sad thing is that the government is addressing us through the press. And then the press, in their usual distortion, is sharing with us that information. I'm not comfortable citing to my people what Star has said, what Standard has said, what Nation has said. I would be happy to receive communication officially from government so that I'm able to share that information with my constituents and I'm able to advise them. This does not mean that this pandemic is not real, but it means that we are leaders. We must be able to deal with the pandemic. We must be able to lead from the front, but we must also protect and defend ourselves. So the 2 weeks would enable our officers and responsible persons to provide protection mechanism for ourselves, but later we must be able to lead our people and also to give them comfort. Mr. Speaker, having said that, I want to move this amendment and hope that it will gain traction and support.
What's your point of order, Senator Murkomen?
I wanted to raise, I didn't know exactly in the procedure at what stage I should do this, and maybe before Senator Chiloyako to complete. As the mover of this motion, I would have really liked if Senator Chiloyako had consulted me before coming with the motion of amendment. And had he done so, Mr. Speaker, I would have told him that this was not just the decision of Senate Business Committee, it was the decision of the Parliamentary Service Commission, which is recommended to both houses. And it's not binding on us. And there is no one who is, we are not a conveyor belt to accept everything that comes from the Parliamentary Service Commission, but there's a story behind it that the Commission itself has worked on scaling down staff. There is also information that many people have traveled and there was a lot of disorganization in their coming in and self-quarantine and so forth. In fact, there are some people who belong to this House and Parliament, Mr. Speaker, who were on the same flight that the fourth victim, Mr. Speaker, with the same fourth victim that has been announced by the CS. So, Mr. Speaker, whereas 14 days might suffice for the 2 weeks that Mr. Speaker, that has been announced, has been said, I wish, because in 2 weeks, as per our calendar, we would have gone for recess. Is it 2 weeks? I think in 2 weeks, yes. Based on our calendar, we would have already gone for recess. I want to persuade Senator Chiloyako, which I would have done if he had consulted me, to let go the 1 month. When we come back on 14th, we make a determination whether we will sit daily or we will now do weekly or twice a week for another 2 or 3 months, depending on the scale of the situation in the country. Because even if we were to stay for these 2 weeks, we would still go for recess because we have a recess calendar already in place. And this thing would have required a lot of consultation. We had a long discussion in the Senate Business Committee on this matter. And I really want to request, it's not mandatory, but I want to request Senator Chiloyako to really let go this one.
Senator Wetangula.
Mr. Speaker, in terms of procedure, was the majority leader in interrupting Senator Ayako, who was moving an amendment motion, giving him information or opposing him or debating the amendment before it is accepted and put on the floor? What standing order was he using to make that interjection, Mr. Speaker? Ochila Ayako was never asked whether he needed information and he never granted it, Mr. Speaker.
Yes, Leader of Majority.
I just said, Mr. Speaker, I don't know if it was on, and I made the disclaimer that whether it was in order for Senator Ochilo to move the motion without consulting me, and if it was in order, had he consulted me, I would have done 2, 3, 4. So I stood on a point of order.
Senator Orengo.
Mr. Speaker, at least I was consulted by Senator Chiloyako. And probably it's good to agree on this because this is one of those motions that we need consensus, really, at the end of the day. And we are not a conveyor belt. The problem that I find is that a lot of the commissions, be it the Judicial Service Commission, the Commission on Administration of Justice, and even the judiciary as a whole, they have made pronouncements where there's a total lockdown. If you go to the courts now, even a senior counsel like Wetangula cannot, Senator Wetangula, you cannot access the courts. In fact, it's the magistrates who are standing at the door, to see who can be, allowed into the courts, admitted, depending on what business you have. And the other thing is, Parliament, we're not just parliamentarians. Without the staff, we cannot be able to operate. And the Parliamentary Service Commission has decided to scale down the activities of our staff. We may well feel confident, but a lot of staff members do not have the same kind of confidence that the constant engagement that we have is safe enough, particularly when a lot of people here have traveled. So I just want to say this is a matter that we need consensus. I, for one, would have wanted us to continue without going on any kind of recess. In fact, I was saying that Parliament should always be in place. But this is a very extraordinary circumstance that the Parliamentary Service Commission, and we cannot direct the Parliamentary Service Commission. You cannot, although we are not their conveyor belt, but you cannot direct them. And they already made a pronouncement that they have scaled down activities. So it is in the entire system. People have been told to stay away and so on. So I don't know whether if we come back, our clerks will be here. But if the employer is a Parliamentary Service Commission, most likely they're not going to be there.
Senator Mutula Kilonzo Jr.
Speaker, in the process of his contribution, although Senator Murkomen says he was giving information to Senator Ochilo Ayako, he made also a very telling statement that I'm not sure whether he can make it or whether it was part of the information.
Order, Senator Murkomen.
He's interrupting because I was wondering about the fourth victim and our colleagues. And that's why I was saying that part of the 30 days should be used as an avenue for us who are members of this House to check our status, because we don't know. We don't know. And that information sends even more panic, even to the members of this House who we are sitting with. So I'm a little conflicted.
There's a point of order from Bushiro.
Mr. Speaker, am I in order to request that I be given a chance? I have been trained in mass casualty incident command and management. Before, maybe it might add a bit of value, and so I'm requesting that before we conclude and the ping pong of point of orders, I request that I be given a chance.
Be given a chance to do it? I didn't get what you said.
Mr. Speaker, I wanted to weigh in on something that might help us with the impasse with regards to go now or go later.
I think okay, what's your point of order, Senator Wambua? And
Thank you, Mr. Speaker. Mr. Speaker, from the contributions from colleagues, I'm wondering whether we should not allow Senator of Migori to finish moving the amendment, then we debate the amendment. Yes, please proceed.
Okay, Senator Ochilo, you conclude, or you've heard what the Leader of Majority said?
Now, Mr. Speaker, the Leader of Majority has ambushed me with information that he did not share with this House. You have to. I mean...
Order, members, order.
Now, Speaker, you have to protect me from the Leader of the Majority.
You are protected.
I believe I have every right to move this amendment, and I believe members have every right to vote for this amendment. And if you do not scaremonger members, the motion you brought will be defeated. members cannot retreat and hide from the people they lead. Members must transparently and honestly share information with the people they lead. If you have some information and you are not sharing with members, the more reason that members become suspicious. Now, Mr. Speaker, this motion is very important. We are not just ordinary people. In fact, we are not a gathering like some members are saying here. We are the third arm of government, and many people who take their time to vote for us, listen to us, and already are pushing for information from us. So the 2 weeks that I am proposing is intended to allow Parliament to look at the practicality of allowing us, after the 2 weeks, to be meeting once a week so that we receive official information. I believe 2 weeks is sufficient time. I believe that there are many, many things for which we stand. We need to, in fact, instead of the government through the ministers addressing the press conference, they should address Parliament live and communicate to Kenyans through Parliament so that we'll help government to share that information out, so that we do not try and glean facts from what is stated in the press, but we get it firsthand from government. We should also be able to get information from our governors and know what they are doing or what difficulties they are experiencing, so that we give the minister feedback so that those things can be dealt with. So we cannot hide. We cannot take a lazy decision of trying to disappear. I believe catering can be shut down. I believe many services can be shut down, but sitting the way we sit, I see, Mr. Speaker, you have 2 members of staff here and a few members of Sergeant at Arm. We do not need many of them. The others might go where they want to go and feel safe. And I believe Parliamentary Service Commission has no right to shut Parliament down. In fact, it's not their mandate. They cannot. In fact, if they try so, they can also be impeached. So that is not proper for us to get information that we can be shut down by Parliamentary Service Commission. We should make a decision that is sensible, and I believe this is a compromise. Rather than defeating the request for adjournment, this is a compromise, and we are basically supporting the leader of the majority to help us achieve a compromise, but also to allow us to be leaders, not to be cowards, not to be people who hide under our beds and receive information from Twitter or social media. Now, having said that, allow me to move the motion and request my brother, Senator Mwaruma, to second the motion. Thank you, Mr. Speaker.
Thank you, Mr. Speaker, for allowing me this opportunity to support the motion of adjournment, but with the amendment that we adjourn today on 17th March 2020 for 2 weeks, so as to reconvene on Tuesday, 31st March 2020, and thereafter hold one sitting each week. I think there is a lot of merit in adjournment, Mr. Speaker. As many speakers have said, we need to go home, and because many people traveled outside the world, and this disease does not manifest itself immediately, we need to give ourselves some time to go home and see who has been affected or infected and who is not. Mr. Speaker, in the new constitution, Parliament was given a prerogative to determine its own calendar, and this is one of the very opportune times that Parliament can manage its own calendar. Many people have spoken, including Senator Farihia, Senator Wetangula, and my brother here, Senator Migori, that we don't need to run away from our responsibility. We need to audit the ongoings of the management of this scourge, the coronavirus. 1 month could be too long for us to get feedback of how the coronavirus is being managed. Mr. Speaker, you know there's a lot of funds coming from the World Bank and so on, and we need to know how it is being devolved to the devolved units, Mr. Speaker. Senator Malala said that most of the level 3, level 2 hospitals do not have even the reagents for testing the casualties. So if the money comes, it is through Parliament that you can push so that this money goes to the devolved units. So we need really to be here and be managing. Also in terms of awareness creation, I would propose maybe you have, for example, Parliament appropriating like 1 billion to go to every county. That's about 20 million for every county, so that there is a lot of awareness creation. When I look, Mr. Speaker, at how we are managing ourselves around here, I'm seeing many people touching their noses, many people touching their eyes, and that's how we spread this disease. So it means that if senators themselves are not aware about how to manage or how this disease is spread, then what about the people who are at the grassroots? So, Mr. Speaker, I would support that we go for 2 weeks, then we come back and sit for every week. If we agree it is Tuesday or Wednesday or Thursday, but at least every week we should be coming here to review even the laws. Senator Malala posited that we need to look at even the NTSA laws, for example, that require every person who is using border to use helmets. If you use helmets, really, NTSA is insisting on using helmets, but us, as in terms of managing coronavirus, if you put on a helmet, you'd spread it further. So how can you have a compromise between the laws of NTSA and how we can curb spread of corona? We might need to change the laws and the policies that are in place. So, Mr. Speaker, I need to support this and say that we accept and let the motion pass through, but with amendments, Mr. Speaker. I thank you.
Okay, Honorable Senators, order. Now, Honorable Senators, I want to propose the question, which is that the motion be amended by deleting paragraphs A and substituting, therefore, the following new paragraph. A, adjourn its plenary sittings today, 17th March 2020, for 2 weeks, so as to reconvene on Tuesday, 31st March 2020, and thereafter hold one sitting in each week. And remember, those who are going to contribute now will be contributing on the amendment, not on the original. Okay, Senator Murkomen.
Mr. Speaker, I stand to oppose that amendment. And not because we just want to be here, Mr. Speaker. First of all, the amendment is not proper. It is not properly drafted because it presupposes that, Mr. Speaker, when we come back, we will meet once a week sine dine, Mr. Speaker. And that's not possible. I mean, if you say we will be coming here to meet once in a week for the rest of the of our term, or, Mr. Speaker, of our session, that's not possible. So if the intention was to meet once in a week, then you should tell us once in a week for how many weeks when we come back. Number two, Mr. Speaker, it must also specify which day of the week, because then if we are the ones who determine our calendar. If you want once in a week, Mr. Speaker, from the time we are coming, then you say once in a week, which day? And as I said, properly speaking, for how many weeks thereafter? And so, Mr. Speaker, if Senator Ochilo Yako wanted to bring a proper amendment, then perhaps he should ask someone to do a further amendment, Mr. Speaker, to that one, which will determine once in a week for how many weeks. It's not just procedures, for how many weeks. Number two, Mr. Speaker, which day of the week? So that then, when we are even voting on it, we deal with something that is definite in nature.
Now, I think those who want to contribute, because there's now a lot of confusion in terms of those who had logged in earlier, I think you'll just get up your hand if you want to contribute on the amendment, and since I know all of you, I'll be able. Senator Ledama. On the amendment, then I'll come. Yeah.
Mr. Speaker, sir, I rise to support this motion. I don't believe that it is actually necessary for us to call for a complete government shutdown because of this imported disease. We have been told that a fourth Kenyan has been found as positive, and he flew from London. All those who have been found to be positive got in touch with the person who flew. So this is an imported disease. Mr. Speaker, sir, I worry about Kenyans who are in the streets. I worry about prisoners, particularly who are locked in prison, and the people who are manning them are in contact with the rest of the world. If we're to go to this panic, we're already bringing a lot of psychological issues where a lot of people sometimes end up dying not because of a disease, but because of the what is it called? Mental challenges. What is it called? Post-traumatic stress syndrome, PSDS. So in this case, Mr. Speaker, sir, I think what Senator Ochilo Ayako, the amendment brought about by Senator Ochilo Ayako, is for us to realize that, first, we've got an economy which is different from the rest of the world. It will be completely hypocritical for us who are blessed to be able to think like, once our life is disrupted and we have a salary, our salary will not stop. The people who are on the ground, the construction workers, those in prison who do not have anyone to defend them will be able to also be cushioned. If we are talking about what this government can be able to do to ensure that, one, those who are out there who cannot be able to come here and pass legislation, to be able to ensure that this government either suspend part of the rule of law to ensure that services can get to the people. Because I was looking at Article 58 of the Constitution, which is the one that calls for an emergency. And I think when the drafters of the Constitution were thinking about the state of emergency on when to call it, they were confused with this state of a democracy, where they gave the president a very limited powers. When you look at other jurisdictions like the US as an example, the president, through an executive order, was able to give the minister or other person in charge of health powers to suspend the application of the rule of law. So, Mr. Speaker, sir, I support this amendment by Senator Ochilo Ayako. I think it is important for us to be here so that we can come up with measures, emergency services to ensure that all parts of this country can be able to get the services that we are currently enjoying. We should be talking about kits to be able to test these people. We don't have any kits that can be able to test and ensure. Senator Mutula Kilonzo spoke about that. So this, for me, I think it is important for us to be here so that we come up, even if we were to come here for, once a week, we need to be able to ensure that our perpetual motion is not affected. I thank you, Mr. Speaker, sir.
Senator Maina, then Ndula.
Thank you, Mr. Speaker. I stand to actually support the amendment. But if I were to be asked, Mr. Speaker, I would have even gone with Senator Wetangula's opinion. Mr. Speaker, the country is in a crisis. And when the country is in a crisis, the leaders should be in the forefront. Should be in the forefront. This is like war. And it is this house to give hope to Kenyans. It is this house to actually make decisions outside the normal decisions, even prompt decisions. Government may need funds urgently, Mr. Speaker, and it is for us to do that. Secondly, Mr. Speaker, we have people in this country who they are not capitalists, but they are actually suckers of blood. People like banks by now should be told to suspend all the charges and the loans that they are charging hefty interest to actually Kenyans who have been trying to create employment in this particular time. Mr. Speaker, the other day the insurance said, if you are having this disease, they will not be in charge. Mr. Speaker, I find this very unpatriotic. I find it irresponsible, and it is upon this parliament to bring laws that can actually change those attitudes, Mr. Speaker. Therefore, Mr. Speaker, my point, I will support Senator Ashilo's amendment in that I felt this House should not have gone in recess. We should be on standby, and whether we come back once a week, Mr. Speaker. We don't need all the staff in Parliament. You should have some core staff whom you can even accommodate somewhere here, Mr. Speaker. If this is the situation we are in, we are here to call upon the government, county governments, to account. We are here to call them, to tell us what they are doing. We are here to keep giving hope to our people, Mr. Speaker. And therefore, I support the amendment by Senator Ayako.
Senator Omogeni. I don't know, I'm giving both sides. I'm coming both sides. I'll give you an opportunity.
Thank you, Mr. Speaker. First, I want to support the amendment that has been put forth by Senator Uchilo. But, Mr. Speaker, there is even a serious outspeaking issue that requires direction from the Speaker. Mr. Speaker, the majority leaders alluded to this House that they are our colleagues who traveled out of the country and who travel back in the same flight with the fourth victim. Even as we propose, Mr. Speaker, that we should have sittings once a week, we need discipline from the House, Mr. Speaker. The Senator for Texas, Ted Cruz, who was in a meeting of a Brazilian who tested positive, went into self-quarantine the moment that news broke out. If, Mr. Speaker, they are our colleagues in this House, distinguished senators who were out of the country in jurisdictions that are affected by this disease, Mr. Speaker, the prudent thing to do is for them to go into self-quarantine, Mr. Speaker, because we need to show Kenyans that this disease is serious and that we as leaders are giving it the seriousness it deserves, Mr. Speaker. It is not proper, Mr. Speaker, for members who are supposed to show the people that we represent here the discipline that we require to control this disease, not to abide by the directives that have been given by our own government. So I want to, Mr. Speaker, to propose that if there is any of our colleagues who may have been out of the country in the countries that have been affected by this disease, let them make self-disclosure and then they go into self-isolation. That's what we expect leaders who are responsible to do. Number two, Mr. Speaker, we cannot, this disease sends a lot of fear throughout the country. But if you borrow best practices, Mr. Speaker, the Senate of the United States of America has not adjourned, Mr. Speaker. Yet there are so many Americans whom, as we speak today, have been afflicted by this disease. In France, Mr. Speaker, the president has passed a law to allow the government spend 45 billion euros to cushion the people who are affected by this disease. It is the responsibility of we as leaders to ensure that we can put in place mechanisms through someone says that we may send to ministers in some responsible ministries to caution the Kenyans, the people that we represent here. Mr. Speaker, if we adjourn this House, Mr. Speaker, there will be nobody who will speak for the common mwananchi, Mr. Speaker. You may find situations, Mr. Speaker, where banks may resort to auctioning people's homes if they are not able to pay their mortgages. And Mr. Speaker, I want to give an example. In September 11, 2001, when there was a terrorist attack in the United States of America, 2 days after that, there was a scare that an anthrax powder had been sent to both Congress and the Senate, Mr. Speaker. And when 2 representatives of Congress and 2 representatives of Senate went to see President George Bush, he gave them a leeway to go and discuss whether their houses wanted to go to recess. Mr. Speaker, Congress did go on recess, but the senator stayed forth and said they will be the generals who will lead the Americans in resisting the threats and fear of terrorism. So, Mr. Speaker, even if members of the other house have passed a motion to adjourn, we are not bound to follow what they have done. So I want to propose, Mr. Speaker, that we go by the proposals that have been put forth by Senator Uchilo, but we put in place mechanisms that will protect the honorable senators who are ready to continue acting as the people's representatives. I support, Mr. Speaker.
Senator Dulo.
Mr. Speaker, I wish to oppose this motion. the amendment. Reason being, Mr. Speaker, I think, Mr. Speaker, when we say we slow down, it doesn't mean we completely close. This morning, I've gone to about 2 departments of national government. They all had meetings to see how they can scale down and see the work continues. The leadership met this morning, and we discussed this matter. And that is the reason why you had a representative in those committees, both at commission level and House business level. And there was a reason as to why this has happened. And I think, Mr. Speaker, instead of us saying whether we are closing or not, where we went wrong from the beginning, are we as a Senate, when health is devolved, are we represented at the national level? That is the committee that is looking at coronavirus at that national level. National Assembly is not involved, Senate is not involved, and that is where you should actually feel that we are left out as an institution. Because if we had our own representative in that committee, then we know what is happening. Number 2, Mr. Speaker, a lot is happening. Kenyans are going to lose jobs. Kenyans are going to actually get depressed. What are we going to do to those Kenyans? Those are the questions we need to ask ourselves. It's unfortunate, Mr. Speaker, I've just seen the flash out that most of the counties have actually prepared isolation centers. Unfortunately, one of the county that has not prepared an isolation center is Isiolo County. When the chairman of COG is in the National Steering Committee for Corona. And that clearly shows how we are unprepared. And that is why I'm saying this Senate should even know how much money is going to be diverted to emergency. And I'm sure Kenyans are going to be taken for a ride. Those are the issues we need to ask ourselves. And I think I'm going to appeal to my colleagues. Yes, we can go on recess, but that doesn't mean we should close down in terms of operation. We need to be even on the ground to know what is happening to our constituents. Because as my colleagues have said, even the dispensaries at the county level, they have not prepared. Yesterday I was in a village where Kenyans are saying, sisi hatujui corona, na tunasalimiana. They're even hugging each other. And these are the people who need to be cancelled, Mr. Speaker. So I think this is not a matter of we close or we should not close. But I think we should come up with a better strategy. And the first point is, Mr. Speaker, you should give a ruling on this, that a chair of this House, who is the chair of Health Committee, to be included in the National Steering Committee of this country. I thank you.
Leader of my minority.
Is on the adjournment motion. I mean the amendment. Mr. Speaker, on the amendment, let me make it straight that I personally am not opposed to the amendment. It is indeed a compromise. It is not shooting down the motion. It's a compromise giving us 2 weeks. And I think there was a suggestion that that motion should also be fine-tuned so that thereafter, after 2 weeks, let it comply with the requirements of the standing orders and so on. And I'm told there's an amendment coming. And therefore, I support the amendment, but only have this to say. Mr. Speaker, if at all you are coming into Parliament, they're using, what are they called? Face thermometer. Forehead thermometer to determine our temperatures as an indication whether we are positive or not, or we are on the danger zone. And I just want to ask members of Parliament to stand there for a while, for even 20 minutes as people come in. You'll find that about 3 people out of 10, their temperatures are in the danger zone. I've been there, and I stood there, I took time. So it's a matter of concern. So, Mr. Speaker, if we come back after adjourning today, and we come after 2 weeks, I would encourage Parliament to have testing kits, and they're very cheap. From South Africa, the 19 rand. In fact, in the parliaments where people are continuing to meet, including the Senate in the United States, the House of Commons, members are constantly being tested. Because we just need one person to test positive, and nearly half of us will be in danger. So, Mr. Speaker, all that I'm asking, now that there's general agreement, is that in order to make sure that we operate in a healthy environment, I think the secret is in constant testing. Absolutely. Yeah, because without tests, we are cheating ourselves. There was an American commander who was saying, you are not, he was talking about somebody being patriotic, and he said, you're not patriotic by dying for your nation. Yeah, you're never patriotic. You are patriotic by making the other person die for his nation. So those who want us to be patriotic, the first starting point is to stay alive. You are not being patriotic by putting yourself in danger. And that is why in the United States, people are self-quarantining. Yeah. And here, nobody has offered, not that they're positive. All those 6 senators who have gone in self-quarantine, none of them have been tested positive. But they said that we have been in circumstances where we think we should self-quarantine. And of course, even the Prime Minister of Canada has decided to stay away from his wife. I don't know how many people here will be ready to stay from their wives and their families. So I believe we can do it. But in order to make sure that we are all safe, I think, Mr. Speaker, I'd plead with you that there should be constant testing. And already we are taking measures. If we liked each other very much, we should not be sitting apart from each other the way we are doing now, except for Senator Kenywa from Laikipia. There's something drawing you towards you. Yeah, so, Mr. Speaker, let me not take too much time. I support the motion in those kind of circumstances.
Senator Uta, I'm told you have another amendment.
Yes, thank you, Mr. Speaker. Mr. Speaker, I beg to move on the amendment to the amendment by Senator Ochilo Ayako to add the following words after the words, one sitting in each week. Mr. Speaker, that is on Tuesdays for 2 weeks until Tuesday, 14th April 2020. Mr. Speaker, I brought in this amendment because it is important as leaders, and as we have heard our colleagues, they have said that we have given a responsibility as a Senate. Health is devolved, and therefore it squarely stands on us as leaders who are mandated to oversee the government's operations. We cannot continue to depend on the media or the rumors, but we must stand with our counties as leaders. As the leader of Kisumu, I must stand and give an accurate answers to the people who elected me. This is the time that they need me, and they do not need any third party with the rumor mongers on this coronavirus. And that's why we can go for 2 weeks. Mr. Speaker, when we come back in 2 weeks' time, the Parliament will be ready for us and to protect us. And as we come back in 2 weeks' time, we'll be able to keep this government on toes to give us the correct information. Mr. Speaker, there's a lot of rumors. People do not even understand about the coronavirus in the villages. Today, when I was calling home about the burial of my uncle who has passed on last week, people are still depending.
Conclude and get a seconder.
Let me conclude, Mr. Speaker, because I was going to having a lot of story about festivities of the funerals where we need to change. But let me conclude, Speaker, to move. And I want to get Senator, this is for the city senators, Senator Sakaja to second.
Senator Sakaja.
Thank you, Mr. Speaker. I rise to second the further amendment to the amendment to this motion, because without it, many of us would not have agreed with the motion as worded. Mr. Speaker, indeed, it is a point, it's a time of need in our country, and I want to thank the President and the Executive for the actions that they've been taking. We're seeing good leadership through CS Mutahi Kagwe and his team, and they said that we need to maintain only essential services. Mr. Speaker, in considering this amendment and even the motion later, I asked myself 3 questions, Mr. Speaker. Number 1, is the Senate an essential service to Kenyans? Number 2, what do Kenyans need at this time? And number 3, what are other parliaments doing around the world? Because it's a global pandemic, it has hit many parts of the world. Mr. Speaker, this is a time for vigilance. It's not a time for anarchy. In fact, the thing that is spreading more than coronavirus is fear and rumors. Those two are spreading farther and faster than coronavirus pandemic, Mr. Speaker. Mr. Speaker, on the first question, yes, indeed, Senate is an essential service. It is something, at this point, and I've heard members saying, let's take this 1 month is the most critical, let's take a break and reassess. Mr. Speaker, in this 1 month or in the next 2 weeks, Kenyans need us more now. At a time of crisis, that's when leadership is needed. Not to take a break and not to look like we're absconding duty or hiding from the people. Mr. Speaker, other countries have faced this challenge. Right now, Mr. Speaker, in the US, they have very many cases, Mr. Speaker. But just yesterday, the US Senate, where there are 6 members who've self-quarantined, the US Senate is debating what they call a coronavirus relief bill. They're doing their work, they're legislating. They're seeing what best to do at a time of crisis. They're not going home, they're not hiding under their beds, Mr. Speaker. Mr. Speaker, but they have put in place measures. There are no visits to Congress. There are no tourists being allowed to go to Parliament, Mr. Speaker. In the UK, there's a death toll of 55. The health secretary herself has been diagnosed. There are more than 1543 people sick, but they've ruled out adjourning Parliament completely. They've just scaled down visits to the House of Commons and to the House of Lords, and they've put in place measures to make sure that it is a time to put your heads together, of course not physically, but put your heads together to see what measures can be taken at this time of crisis, not to go home. Mr. Speaker, today if I go home, the people who are congregating in Marigiti and Nyamakima will say, oh, the senator is safe, but us, we have been left to our own devices. Who will speak to the people of Nairobi? Who will question national government? Who will question county governments on this issue? Mr. Speaker, in India, as I go to finish, yesterday, the Prime Minister, Narendra Modi, had a parliamentary group meeting with BJP MPs, where he told them, in fact, at this time, please give us ideas, go to your constituencies over the weekend, talk to the people, but legislate. Our work right now of legislating, representing, and oversight is more important than at the time of calm and at the time of peace, Mr. Speaker. The same thing is happening in South Africa. In fact, they have many cases. They have 62 cases. But what they've done, they've said they meet once a week in terms of their parliament. The National Congress of Parliaments is meeting on Wednesday, and they're also meeting once a week for urgent business. This is a time to appropriate. This is a time for us to look at Article 109 of the Constitution. Article 109 talks about support to county governments. Support to county governments at a time of a health crisis is extremely important. How will you do that if the Senate is not sitting? So, Mr. Speaker, I urge members to support this amendment. Because if we do not, Kenya will be the 3rd parliament in the world, with 4 cases only, the 3rd parliament to suspend or to adjourn its sittings after Canada, where, of course, the Prime Minister's wife has been diagnosed, and Iran. Even China has been meeting in one way or another. So let us not run away. This is a time to show leadership, Mr. Speaker. This is a time for us to show support, to do that oversight. Senator Dulo said that we should know how much has been given to the counties. We can't know when we're at home. In fact, Mr. Speaker, we must say as a Senate that we want a weekly meeting with the CS to update Kenyans on the measures being taken. Once a week, when we meet here, we meet with the CS, because when they do a press conference, they're not questioned. Those press conferences are not oversight. He's giving good information, but the voice of Kenyans, Mr. Speaker, 4.7 million Nairobians who want to ask something. There are millions of Kenyans represented here who want to ask. So let's say once a week, the CS of Health comes here. Let us think, we have creative minds. Senator Orengo, Mutula, let's look at Article 109. How do we give some temporary but serious support to counties in the health function? We cannot do that if we are at all, Mr. Speaker. I support the amendment, and if it doesn't go through, I oppose the motion of adjourning. Thank you, Mr. Speaker.
Honorable Senators, I now propose the question of the amendment to the amendment as proposed by Senator Uta, which is that the following words be added after the words "one sitting in each week on Tuesdays for 2 weeks until Tuesday, 14th April 2020. But I now want to call upon the leader of majority, who had moved the first motion, to make things easier for us by what he's going to say. Senator Murkomen.
Mr. Speaker, we have consulted with Senator Ochilo Ayako finally, and Senator Uta. That's how we ended up having Senator Uta to come with that amendment, which is more definite, Mr. Speaker. It has the days, which is Tuesday, but also for only 2 weeks. So we are going 2 weeks full and 2 weeks for once a day for another 2 weeks until 14. When we come back on 14th, Mr. Speaker, we now make another calendar, which will be more definite. Because of that, Mr. Speaker, I would like to request the House that we then complete, to avoid debating the further amendment and then the amendment, since there seems to be now a consensus, we dispose the further amendment and the amendment, then you take us just through, then people can contribute to the main motion, Mr. Speaker, as amended. Then we progress. Otherwise, if people go around the further amendment, and then we go to the amendment, and then we go to the motion, Mr. Speaker, we'll spend the whole afternoon here.
Yes, Senator Mutula.
Speaker, can I propose a further compromise? Senator Sakaja and maybe one of our colleagues has raised a concern, and I had mentioned this, that it is futile to go away for 14 days and we come back, again continue talking. I'm surprised that the Chair of Health is not here. In 14 days, this Senate must guide the country in terms of how do we go about this issue, one by one, in something that looks like an emergency protocol, which we can pass a resolution, which can be followed A to Z. But two, the testing of senators. How is that going to happen? So, Mr. Speaker, I would suggest a further compromise where we are meeting the CS, and the CS is telling us, have you procured kits for senators who continue working throughout, can be tested? Because it's futile for Sakaja to go to Marikiti and he's himself not even sure whether he's sick or not. So, thank you, Mr. Speaker.
Okay, honorable senators. I want us to vote on the amendment to the amendment. So I now put the question, which is the question of the amendment to the amendment as proposed by Senator Uta, which is that the following words be added after the words "one sitting in each week on Tuesdays for 2 weeks until Tuesday, 14th April 2020. As a manner of that opinion, say aye. Aye. As a manner of a contrary view, say nay. The ayes have it. So we now go. What's your point of order, Senator?
Mr. Speaker, in order not to repeat a debate, I was going to suggest that you put the question on the Ochilo motion as amended, and then we can go to debate that motion as amended. Mr. Speaker, just to be clear, we are debating, we want to put the question on the Ochilo's motion as amended. And then after it's amended, then we go to the motion as amended.
Yeah. Okay. Other members, we are now voting on the amendment by Senator Ochilo Ayako, as amended. I now put the question, which is that the motion be amended by deleting paragraphs A and substituting, therefore, the following new paragraphs. A, adjourn its plenary sittings today, 17th March 2020, for 2 weeks, so as to reconvene on Tuesday, 31st March 2020, and to thereafter hold one sitting in each week on Tuesdays for 2 weeks until Tuesday, 14th April 2020. As many of that opinion say aye. As many of a contrary view say nay. The ayes have it. Okay, order members. Okay, I now propose the question, which is that the motion be amended by deleting paragraphs A and substituting, therefore, the following new paragraphs. A, adjourn its plenary sittings today, 17th March 2020, for 2 weeks, so as to reconvene on Tuesday, 31st March 2020, and to thereafter hold one sitting in each week on Tuesdays for 2 weeks until Tuesday, 14th April 2020. Now the debate will continue. Okay, Senator Abshiro, it continues. Okay, we are now back to the screen. No hands. Okay, Senator Abshiro. What's your point of order, Senator Mutula Kilonzo Jr.?
Really?
As whip, I was wondering out loud, so that because people are streaming out slowly, and I don't lose members. Mr. Speaker, I wanted you to make a determination and I don't want, I'm pleading that you give us direction that this is not a matter concerning counties, so that I don't have a problem when people leave. This is something that I think Speaker must direct us on. Thank you.
It's not a matter concerning counties. Senator Abshiro.
Can I get a mic? Thank you, Mr. Speaker. Mr. Speaker, as I stand to support the motion, I'd like to just bring the attention of this House to certain features of a mass casualty incident management, which is what is impending before us right now. Mr. Speaker, sometimes I know a few of us have talked about this being a time of war that we as senators must be there to fight. But sometimes the best war is fought when you get out of the way of a spectacular failure by being there. Mr. Speaker, we are not experts in managing viruses or coronavirus for that matter. And I hope even as we come to work, we are not going to be in the way of the response to this nation, Mr. Speaker. I know we've spoken about needing information and not wanting information to come to us from different sources or third parties, and that we want the minister to come to us, and I'm appealing to this House. I have been trained in mass casualty incident command and management. Sometimes we as politicians might come in the way of the response, demanding so much, being maybe wanting information being given to us, which then takes away the first responders, the minister or whoever it is that is responding to the pandemic or trying to get the resources to then be diverted from the response to then dealing with us as a House. So I hope even as we do this, as we demand information for our constituents, we are also going to balance this with ensuring that the people that need to respond to the country and to the coronavirus and to get resources for it are given enough time to do that. Mr. Speaker, we need In fact, one of the reasons why Senator Murkomen's initial proposal may have lacked a bit is because it did not really tell us that the response plan by this House itself. In the while we are away, what are we going to be doing? Are we going to be looking at procurement of testing kits? Are we going to be part of a multi-agency team that is going to be looking at how the response of the country is going to be managed, and then coming back to this House with our part of what we need to do? Or are we going to be managing some of these things that we are going to be saying that we are going to do? Are we going to look at the transportation, the procurement and things like that? So the plan of action that this House was going to do is going to be very key as we respond to this multiple protocol. And I hope that as this House, we don't look inward at our own needs and at our own perhaps a hierarchy to then defeat something that needs a lot of focus from the executive, from ourselves, and from the immediate responders. Mr. Speaker, I have a concern. We should not be comparing best practice. Yes, coronavirus appears across the board, but the response initiative, what we have as a resource as this country, is not the same at all. Therefore, our response cannot be replica of the response of the United States or of Italy or of America. So we must, as this House, look at our own situation and look at it very critically with our resources in mind, with our needs in mind, with our level of awareness in mind, and then with that in mind, make sure that we respond and we support the process as opposed to becoming an impediment to it. Mr. Speaker, as I sat here, we have different ways in which we could do. People have talked about telemedicine. I know every county is coming up with something, but there's a lot of duplication. Is there a situation where perhaps telemedicine and other innovative approaches can be used, and this House can encourage that and to make sure that there's information sharing, especially with regards to community information, where this Senate can come in handy. Mr. Speaker, in terms of us being treated or us being tested, are the rest of Kenyans being tested? So if again we become selfish, let the senators be tested. What about the people out there that are not being tested? So just last week alone, only 1,000 test kits. I know the 19 Rand one is not really the certified WHO kits. I can tell you that for a fact, because from here I'll be going to be joining the response team at the Red Cross to help with whatever I know about mass casualty incidents. And I can tell you for a fact, there were only 1,000 certified WHO, African Union Center for Disease Control given ones. Now, of that 1,000, do we want to then use them ourselves, or do we want to then reserve them for the most needy of the cases, while we manage the other cases then as need arises? So again, please, let's not become...
Senator Ledama.
Hey, Mr. Speaker, sir, I thank you. Mr. Speaker, sir, I was listening to Senator Bishiro Alaki, and she was speaking to what this government ought to be listening. I want to equate her speech with one legislator in the US who was able to move and push the surgeon doctor, or what was his name? The surgeon director in the US, to ensure that every American got free testing. Because, to be honest with you, this is not a disease that you can easily just say, with that forehead thermometer, that Sakaja has coronavirus. It is a disease that you cannot, no. Let me just say, let me qualify my statement. When we walk into this parliament, Mr. Speaker, sir, you know, the Sergeant at Arms outside, you know, point the forehead thermometer to our head, and if the temperature reads 37.8, we are taken into self-quarantine, and some might even assume that Olekena has coronavirus. Mr. Speaker, sir, this is an issue which, of course, we should not panic about it, but we should also be very, very careful. In terms of testing, I would like the current minister, whom I really respect, because for once, I want to say meritocracy is at work. It has fully worked in this country with the appointment of former Senator Mutahi Kagwe. Because when he speaks about what his ministry is doing, as a Kenyan, you feel confident. So, Mr. Speaker, sir, what I'd like to encourage the CS of Health is to try and push so that every Kenyan can get free testing. We've always been complaining that the Ministry of Health is given a budget equivalent to 5 counties. It is about time now we see the money in the Ministry of Health being used to support those poor Kenyans who cannot be able to get access to even the 19 Rand kit or the actual test kit that Senator Halaki is talking about. Mr. Speaker, sir, I'm worried about the economy of this country. Because, you know, in this country, we must have a perpetual motion machine. We buy. When we buy, we spend money. Those who need the money use that money to pay salaries. What happens when we have a complete government shutdown? What will happen to those people who are working, who cannot be paid by the government as we are paid? So, Mr. Speaker, sir, it is an important thing that we must consider. And that is why I was asking earlier on, do we really need a complete government shutdown, or do we need to be able to be proactive so that everything we make is perpetual? It is something which will be able to help this country. Mr. Speaker, sir, I'm concerned about the social effects, stigmatization. You know, when you self-quarantine, as now what we've been told by the minister, is that it is mandatory. Because he said the Public Health Act is in effect on quarantine. But what does it really mean? I'm told that our colleague from the other house who traveled abroad has been sent home to self-quarantine. What happened when Honorable Kenan now goes home? Will he sit down in the same house with his kids? Will he be able to go and set a small room out there? What about his psychological effect? There are serious things that this government should be telling us on how they are preparing Kenyans. The issue of our social gatherings. Mr. Speaker, sir, I had the Council of Governors chair talking about suspending all mortuary operations. So which means now psychologically and socially, Kenyans are affected because there are those who value their last rites. So this is a very serious issue that we need to be able to deal with it seriously. So, Mr. Speaker, sir, this motion is timely. It is timely because it gives us an opportunity to go think, look at what the government is doing, you know, consider whether it is for the benefit of our people. When I go to Narok tomorrow, Mr. Speaker, sir, the first thing that I'll do is to ensure that I look for volunteers who are trained, health practitioners, so that we can be able to go to the markets, use these sanitizers. If we cannot afford them, get a soap so that it does not affect our perpetual motion machine. If a Maasai cannot be able to go and sell a cow, where do you expect that person to be able to get food? If another Kenyan cannot be able to go to the market and sell some linen, where do you expect them to get food? So, Mr. Speaker, sir, this is an issue that all of us here should be very, very serious about. And the national government must now think seriously. And that is why earlier on, I was actually even sharing it with my colleagues and saying, Article 58 of the Constitution, really, once we amend the Constitution, we must give the president enough powers. This House has not been given a role to play when it comes to declaring of a state of emergency. You know, we cannot just be rubber stamping things, yet we are supposed to be representing counties where they make up the huge population of this country. So, Mr. Speaker, sir, as I support this motion, I think it is important for us to really think critically about even the prisoners. Because the prisoners, they are held in one area. I heard the president giving directive, Mr. Speaker, sir, of schools to be closed. What about prisons? What about those officers who work in prisons? Should they also be confined in the prison centers so that they are not in touch with the outside world? You know, because if that's not taken into consideration, Mr. Speaker, sir, what will happen is that we may end up sentencing those poor Kenyans who committed a crime. You know, we might end up killing them. So, Mr. Speaker, sir, as I support this motion, I hope that Parliament and also the Parliamentary Service Commission will now sit down and seriously think and say, as another arm of government, what are some of the things that we can do to ensure that this country progress? I like what the Americans did. When the US president signed the executive order, it suspended the operation of certain laws and gave the CS in charge of, or the secretary in charge of health, more powers to be able to, circumvent the rule of law and ensure that certain things are done to help that country. That is what we should be talking about in this parliament. We should be making sure that we help our people. I support.
Okay, I'll be giving the next speaker. But I also want to just say this because I know it's going to be approved, that the Parliamentary Service Commission uses this window, this period, to put in place all mechanisms, including purchasing testing kits for Parliament, so that all members are able to be tested and we have confidence. Because what is being done now is just, that the first aid to check whether your temperature is high or not. So I think by the time we come back, I hope that the Parliamentary Service Commission will have been put in place all those mechanisms to make sure that all senators or all members of Parliament are safe. Senator Professor Kamar.
Thank you, Mr. Speaker, for giving me the opportunity to join my colleagues in supporting this motion in the amended form. Amended form is, the amendment was very useful, Mr. Speaker, because I agree with colleagues that we cannot just shut down Parliament when there is crisis. There is need to have Parliament also speaking. And maybe we are the right house to actually do that kind of amendment, because the other house is more at risk than us. Having a crowd of 347 members is not going to be very, very easy. So at least the 67 members can, after 2 weeks, be here, and we can be able to take the risk to be around and to speak to issues as we assist the country move through this very difficult situation. Mr. Speaker, the issue of the coronavirus is really hitting the world, and we are also being affected, not just on the medical field, but also in the social area. Mr. Speaker, yesterday I had the opportunity to join the Uasin Gishu County response team meeting, and when I went for that meeting, I even discovered more things that I never thought about earlier, because earlier in the morning I had gone to say to give my condolences to a family in the neighborhood that had tents all over preparing for a funeral for today. And then we discovered that actually the public is not very conscious about what is going on. And thereafter, after our meeting, when we had a press release, it was nice to see the county commissioner make a ruling that funerals and marriages are now going to be limited to the smallest population possible, next of kin, and of course, make it as fast as possible so that the contact between people is reduced. I think we really need to speak to the public to obey these kind of rules, because if they don't obey, then we are going to have a major crisis arising from the spread. Currently, we don't even know who has spread what. But the other thing that really needs to our attention as legislators is the issue of fake news. So, Speaker, before the minister announced the fourth person at 3 o'clock today, we already heard in our social media that there was somebody from the slums in Muguru that had been rushed to hospital, that there's somebody from Kambisamaki.
What's your point of order, Senator Wambua?
Thank you, Mr. Speaker. I really would not want to interrupt my teacher, Senator Professor Kamal. But because, Mr. Speaker, this is a House of record, and what she says is going on the hazard. The Speaker, just to correct that the things that have been put on hold is not marriages, it's weddings. Because she did mention that the county commissioner has put on hold burials and marriages. I think what has been put on hold could be weddings. Thank you, Mr. Speaker.
Mr. Speaker, maybe to put it on record, what was put on, it was not put on hold. Nothing was put on hold. What was announced was that we need to limit the number of people attending funerals and marriages. And this is very important because immediately you have a huge population, it becomes another high-risk area. So the whole announcement was really to ensure that we have a limited number of people who can attend these two kinds of functions, which are very common functions for us. Funerals are very, very common these days. And it's very important to reduce the numbers and to make the funeral as fast as possible. And that is what we thought. The other thing, Mr. Speaker, is that as we talk of responding, our response must also consider those people who depend on one day's job for one meal for their families. We have people in these slums who go and work, and that's the day they earn for their families. It is very important that we really map them out again and consider them, because this is also part of the response. We cannot close them down and then we lose them through hunger. We really need the ministry, the national response team, to map out areas where people must work to get their daily meals. And those are the people who should be in food rations. They should be considered the way we consider food rations for areas that have been affected by drought or floods or whatever. I think this is one area that needs also to be looked at. Mr. Speaker, I believe that if we are going to have the meetings after 2 weeks, it's also important that we have the Committee of Health and any other committee, because committees are limited and will not have a risky crowd when we have committees of 9 or 15 people. It is very important that the Committee of Health continues to meet, because as was said rightfully, we need to get reports from the Ministry of Health. But who is going to receive that? We must have our Committee of Health in session throughout this period so that they communicate to the relevant ministries and communicate the same to the public so that everybody feels comfortable. With those remarks, I support.
Senator Mazayo.
Asante Bwana Spika. Bwana Spika, kwanza nataka kushukuru kwa kunipa nafasi hii. Na vile vile pia mimi nataka kukubaliana na mjadala huu kwa kwamba badala ya kuchukua siku 30, bunge letu la Senate liweze kuchukua siku 15. Na kadri ya wiki mbili zitakazofuata siku moja katika kila wiki. Bwana Spika, mimi nilikuwa nataka matamshi yangu katika mjadala huu itakuwa ni kwamba kwanza tuweze kumshukuru yule waziri wa afya kwa ujasiri wake wa kuweza kueleza Wakenya, Mheshimiwa Mutahi Kagwe ama Seneta Mutahi Kagwe. Na sisi tulikuwa tunajivunia kwa sababu tuliketi naye hapa kwa mhula ule wa bunge la Senate lilokwisha. Alionyesha ujasiri wa kuweza kuangalia hiyo wizara ya afya kikakamavu. Bwana Spika, kitu cha kwanza serikali inatakana kufanya ni kuangalia vifaa vya kazi. Bispika, pole, nimekuwa nikikuita Bwana Spika, lakini ni Bispika, na nyuma sijui kama watu wanaelewa Kiswahili, sikusikia point of order, lakini nashukuru nimejiweza kujirekebisha mwenyewe. Wambua, wajua Wambua anatoa Kitui.
I can see a point of order from Senator Nderitu. I hope you did not invite it.
Nimeshasema kwamba nimekosea.
There is a point of order. There is a point of order from Senator Nderitu. Kinywa.
Ni hoja ya nidhamu. Nimemsikiza seneta nikasikia akisema ya kwamba waziri aliye katika jukumu ya kuangalia mambo ya afya ni mtu jasiri, na akasema ya kwamba yeye ni mtu jasiri na ako na uwerendi katika kazi yake. Lakini Mswahili anasema usikate kanzu kabla ya mtoto kuzaliwa. Yeye amekuwa kwa muda wa wiki mbili. Vile anavyompongeza inaonekana kana kwamba tungengoja kwanza tumpe mwezi mmoja, mwezi miwili ndio aweze kutuambia vizuri kwa mapana na marefu. Lakini kwa kusema tu jambo la kwanza kutangaza ati Wakenya wako na corona, huo ni ujasiri. Mimi sioni ujasiri. Ujasiri ningeuona kusema ya kwamba tumetibu watu 5, kulikuwa na watu 20, watu 5 wametibiwa na wameenda nyumbani. Kwa hivyo kusema ya kwamba ni jasiri, sioni kana kwamba ni dhahiri wakati huu kusema ya kwamba yeye ni jasiri.
Asante Mr. Speaker, sijui kama hilo ni swali la nidhamu ama ni mwelezo ananiuliza kama anataka kunieleza, lakini sikuweza kumwelewa. Asante Mr. Speaker.
Go ahead.
Mr. Speaker, sisi sote ni binadamu na sisi sote pia vile vile tunaweza kupatikana na hivi virusi vinavyoitwa corona ama COVID-19. Mr. Speaker, hakuna aliye mjasiri mbele ya ugonjwa. Kwa hiyo ni muhimu pia sisi kuweza kwenda kule mashinani, kuweza kukutana na wananchi ambao tunawakilisha katika bunge letu la Senate, ili waweze kutueleza masaibu wanayopata. Mr. Speaker, unaweza kuona wakati kama mimi naongea, maseneta wawili wako mbele yangu na mimi ninataka kuongea nikiwa ninakuona wewe. Je, ni haki hii? Asante Mr. Speaker. Mr. Speaker, vile vile nilikuwa nataka kusema kwamba vifaa vile ambavyo viko katika hospitali ni vifaa ambavyo ni nadhifu. Either havifai, haviwezi kuzuia ugonjwa, ama sivyo vifaa vile havitoshi. Juzi tuliona sehemu za Mbagathi ama sehemu mbalimbali katika nchi yetu ya Kenya. Bado madaktari, bado wasaidizi wa madaktari, wale manurses, bado milangoni, bado wale wanaofanya kazi za kuosha hizo wodi, bado wanafanya na mikono mikavu. Hali tukiangalia upande ule mwingine, tunaona kuna vifaa vya kujilinda na virusi vya corona. Kwa hiyo Mr. Speaker, jambo la kwanza serikali inatakana kuzingatia ni kuona ya kwamba vifaa hivyo vimeweza kupatikana kwa haraka iwezekanavyo, ili wale wanaoweza kutibu na wale wanaoweza kuwatibu wale wenye virusi hivyo vya corona wameweza kupewa nafasi nzuri ya kuweza kujiweka kisawasawa, wasiweze wakapata huo ugonjwa. Jambo lingine mimi nilikuwa nataka kuelewa kuna nini ndani ya KEMRI. Manake tunaambiwa hii KEMRI ndio Medical Research Institute. Sijui jambo lake linalofanya nini. Kama ni sanitizers, hizi sanitizers zimekuwa ghali sana kwa mwananchi. Nimeenda juzi mimi nikitaka kununua na ni 2,000. Ikiwa mimi naweza kununua hiyo, sijui kama hicho kitaweza kuwa chakula cha siku ngapi kwa yule mtu aliye huko nyumbani. Kwa hiyo mimi ningeomba ya kwamba serikali iangalie jinsia inaweza kuregesha hii dawa ya kuoga mikono ili virusi viweze kumalizika. La mwisho Mr. Speaker, ni kwamba nataka kumuunga mkono kwa mbali huyu ndugu yangu Olekina aliposema kwamba kuna wale ndugu zetu wanaofanya kazi industrial area, wanaofanya kazi za chini, wanaishi katika nyumba zao. Hizi nyumba wanalipa kodi kila baada ya mwezi. Serikali ichukue hatua ya kuweza kupanga mikakati ya kisawasawa. Hizi kodi wanazolipa kila mwezi, katika hii miezi mitatu waweze kupewa nafasi ya kuvuta pumzi, ili wasiweze kulipa hizi kodi za nyumba. Ili Kenya pia Wakenya wengine ambao wako chini hivi sasa, ikiwa watajiweka ndani ya majumba hawataenda kazini, waweze kuokoka na hili janga la virusi vya corona. Asante Mr. Speaker kwa kunipa wakati huu. Asante sana.
Asante sana Senator Mohamed Mahmoud.
Thank you very much, Madam Speaker, for giving me the chance to contribute to this urgent motion. Let me also support this motion. Madam Speaker, we are in a very serious period this pandemic of COVID-19 is a disaster in the world. It has been reported all over the world, in Europe and Americas, in Africa. In fact, if you look at the map of Africa where it has been has been found, you see the whole continent is there. Madam Speaker, I think it is time Kenyans took this pandemic seriously, because if you look at the social media, there's a lot of people who are creating in their minds that this is not correct. The way you saw that lady on the social media this morning, quite a number of Kenyans are actually saying this is not true, that the government is taking for a ride. I think Kenya, the government and ourselves have a lot of work to engage in civic education of our people. Our people must be told this thing is with us, and it must be taken seriously. I remember when HIV/AIDS came to this country in the 80s, late 80s or mid 80s, people were just brushing aside. They said this is wrong, this is not right. The same thing is happening now, and I think Kenyans must be told that this is a matter which is very serious, and we must be able to take it seriously. Madam Speaker, I would like to thank the government for the steps it's taken so far in terms of bringing this to limelight, and in terms of coming out publicly at the highest level to tell Kenyans that we have a serious matter in our hand, and this must be taken seriously. The closure of schools, which the first few days people are doubting, the fact that the schools are closed now, I think there's no better place to close at the beginning, because children in their large numbers together, flus are actually spread at schools and among children. Madam Speaker, so far the action taken by the county government also, this morning I was seeing a lot from many counties, including my own county, Mandera, which have issued a lot of directives and a lot of circulars and procedures, and even set aside isolation areas for people who are, for people to, in the event that there are people who are affected. Madam Speaker, I think we must be upscaled, this matter must be upscaled, and we should not actually take it lightly. The fact that we are on adjournment today, I think we as Parliament, first of all, the leaders of this nation, and also as a place where we congregate so many of us, I think also must take care of our health. I think parliamentarians and the staffers in Parliament must also be taking care of their health. That's, I think, the reason which prompted us actually to go on closure, not that we are run away, because the crowd, this Parliament houses over 416 members of Parliament, and maybe equal number of staffers, if not less, if not more, I think. That's why actually we also need to be careful that if you look at the dining hall during the lunchtime, in fact, that place is so crowded that if you have anybody infected, then everybody is in danger. So I think the fact that we are going on recess, in one way, is also to protect ourselves, not that we are going to run away from our responsibilities. But my worry is, we are talking about 14 days and 30 days. I don't know what will happen in those 14 days and 30 days. What will happen? The pandemic is starting now. It is coming. We are talking about everything. Say quarantine somebody 14 days, quarantine somebody this, do this 30 days. I don't know what will happen thereafter.
Order, Senator, there is a point of intervention, point of order from Senator Mbogo.
It's a point of information, if you would permit. Thank you very much. In those 14 days, Madam Speaker, we expect Parliamentary Service Commission to put in place measures, practical measures to protect this House from the spread of coronavirus. We expect kits to be found, scaling down of staff, and other measures relevant. For the subsequent 2 weeks, we as senators share information with our constituents. We want to be formally updated by government. We also want to bring formal issues from our county so that government can deal with. Thank you, Mr. Speaker, Madam Speaker.
Okay.
Thank you very much, Senator Ochilo, for the information. But still, I think that even the schools, when they're closing, I think they always give some time limit. That's why my worry is this time being given. What will happen next? And I hope in that period we'll be able to upscale our preparedness and also deal with issues of vaccines so that, this matter is dealt with properly. Madam Speaker, this morning I was reading in the papers that, the isolation wards are also not very secure. People who are isolated are actually mingling with the other patients very freely. The staff themselves are actually freely mingling with others. I think we must take this seriously. I think Kenyans are facing a very serious matter, and usually we take it very lightly. There are a lot of, the governor in Mombasa said he closed all the bars. What happens to the bars in Nairobi, the clubs in Nairobi, the bars in Nairobi, and all those idle places? I think they must be shut down so that, we don't have all these, people just congregating and just idling around and saying, no, Corona is there, it is not there, it is there. So, Madam Speaker, I think the decision we are taking today as Parliament, let us also demand that that national committee, which is giving a press every time, I think Parliament must be briefed accordingly also, because they are the ones who are doing that work, so that, we can be able to also take our duties seriously. Madam Speaker, with those very many remarks I support, and I think in the course of time, in the next 14 days, things will be better so that, we can come back to our schedule. Earlier on, when we were debating 30 or 14 days, I was wondering, because, with the light touch, when we came back on 11th February, we hardly passed any motion here because we are not here, all of us. So members, let's take our job seriously. I think severally we are not able to have a division in this house in the last 3 weeks, because every time we have no quorum. So I think being away 14 days, 30 days, whatever it is, let's take everything so that, by the time we come back, we know at least we have done some serious work in that time. With those few remarks, I beg support.
Thank you, Senator. Senator Samongeri.
Thank you, Madam Speaker, for allowing me to weigh on this subject. Indeed, we have a pandemic. In 1990, we had a national disaster in the name of HIV/AIDS. I was then the Minister for Health. It took us to be able to persuade the President to allow the sitting of the National Assembly to have a special sitting in Mombasa in Intercontinental Hotel for it to be declared a national disaster for obvious reasons. At that time, the drugs available for the management of HIV/AIDS were drugs which were under patent rights and therefore were extremely expensive and out of reach for our populations. And when that national disaster was declared, we were able to trigger the WTO arrangement and agreement, Article 6, that allowed this nation to bring in what we call generic drugs. And that's the message that we passed out to Kenyans, that for every 100 Kenyans, 14 might be positive. In other words, 84 were negative, or 86 were negative. And the message was, why don't you go for testing? I think we must follow that lead. And immediately after that, we had the anthrax scourge. You remember, and it happened to have been around that time again, led the country towards this message. So what must we do on coronaviruses? We have two levels of government. We have the national government. The national government has done extremely well. They've become transparent. They've been able to tell us what the problem is and how they are tackling that problem. We have the second tier of the government, the county governments. I'm not quite sure that they are in sync or they follow strictly what the national government is doing. I get the feeling that the most of the emphasis is being laid on isolation kits and other places where those who are positive can be treated. No harm in doing so. But my worry would be, how do you prevent those, the majority who are out there, not to be able to get coronavirus? That's where our effort should be. And therefore, this recess for 2 weeks, Madam Speaker, I would suggest that one of the most fundamental decisions that must be made both by Parliamentary Service Commission, and I wish also that they had the health committees from both houses sitting concurrently so that they can define the final strategies that will be put in force in congested areas, in urban and the city centers, city areas, what we can do with the rural populations, how we can be able to package messages so that they are able to know and in full knowledge of what must happen and the meaning of self-quarantine. Now, that is applicable in some of developed nations because then they say you go to your room, you are with your family, they'll get you a separate bedroom. How many of our people have separate bedrooms in this country? None. Therefore, we must be able to look for a method of doing it. And thirdly, Madam Speaker, I would have expected that we would have also called in some of our premier research institutions, KEMRI, and all other areas that are involved in virology or the infectious disease studies in our various universities, put their minds together rather than having one occasional person appearing in the television with definite messages, how we can package a very powerful message of saving this nation. I feel that one of the ways that we can do, and some of us are available to give information on how these matters can be handled so that we do not make a mistake. Because the time we make a mistake, it will move from a pandemic to a national disaster when we may not even be in a position to be able to handle it. And earlier on, I had heard one of the colleagues, senators, talking about the resource mobilization and the loans that have come. How are these loans being utilized? Are they going only for
Thank you, Senator. I know we would have given you half a minute because you are in the field. Half a minute, please.
Yeah, thank you very much. So I would have expected that these resources coming, that we must be able to tell government how these resources are being utilized for prevention and what measures must be done for prevention. And I've seen these, the sanitizers. Yes, it's good to have a sanitizer. They're expensive because last time I bought one was 700 shillings. Today I hear it's 3,000 shillings. Out of reach for anybody. My message to the ordinary citizenry, simple soap with water, running water, is enough to be able to control this coronavirus. It's a mild infection. It gets very acute. It can become difficult to treat. It can cause complications. It can cause loss of life, and therefore we need to tackle it head on. Thank you, Madam Speaker.
Thank you, Senator. Senator Inima Gertrude Musuruve. Yeah, I'm having a problem. I see Harkura's card without Harkura. And Harkura's card is asking to speak. At the same time, it's intervening on a point of order. So some of you may be holding that card. Okay, we'll move very fast. Let's try to be fair to each other because all of us want to contribute. Let's be as fast as possible, but the order that's followed now will follow.
Thank you, Honorable Speaker, for giving me this opportunity to support this motion with amendments. And I want to say, Honorable Speaker, that it humbles me to say that when we were sworn in, and I remember when I stood there, I actually said before Kenyans that I was going to serve with determination despite what. And I want to say, Honorable Speaker, that it is at this time that our leadership is actually on test. What we saw, are we going to stand by it? So I want to support this amendment that as senators, we are on duty 24 hours, and Kenyans are actually looking up unto us. In a situation where there is hopelessness, Honorable Speaker, Kenyans wants to see hope in the eyes of their leaders. So as leaders, we must really face this situation with courage. We must face this situation.
Order, members, please don't talk across the table. Continue.
Thank you, Honorable Speaker, for for coming into my rescue. So, Honorable Speaker, what I'm saying is that Kenyans are really watching to see what are the leaders doing. And I want to say, Honorable Speaker, when we were sworn in for the sake of Kenyans. And a situation like this, when there's a calamity, a situation like this, when Kenyans are stressed, a situation like this, when Kenyans are wondering what is the next move, as a country, they should look at us and see that there is actually hope for tomorrow, because this coronavirus has adverse effects even on the economy of this country. And yes, many things are going to happen, but we are going to show, we need to really show Kenyans that we are standing with them. And especially this time, this is the time when opportunities are really popping out, Honorable Speaker. Now, when it comes to sanitizers, and I want to say on the floor of this House that those sanitizers are not really too easy to come by on the shelves of malls and supermarkets. Last week, I was, hopping from one supermarket to another looking for sanitizers. I was not able to get, Honorable Speaker. And I remember someone telling me that she was going to get me sanitizers from Cambridge, and she made me pay her 2,400 for sanitizer, which I never got. The following day when I asked, she said that they were out of stock at 800. So I ended up paying 3,200 for sanitizer from Cambridge. Up to now, I have not received. So I want to say, Honorable Speaker, we have a duty as Kenyans to ensure, as leaders, to ensure that we are actually providing leadership in this particular issue. And also as a Senate, Honorable Speaker, governors have their position on this. The executive have a position on this. But for senators, what position are we taking? So I want to say that even as we meet with our constituents and come and give feedback on the floor of this House, at the end of the day, we are going to legislate, come up with a policy that is going to help all Kenyans, Honorable Speaker. So Kenyans are looking at, upon us, and we have a duty to ensure that we come up with legislation that is going to help the common man, because some of them do not know what they're going to do. Some of them are not on permanent employment, and they're wondering how they're going to really fend for their families. We are here to protect that common man who is wondering that, that one who wakes up very early in the morning to go to a construction site, to go and paint, to be on the farm. We have to stand as a Senate and ensure that we are defending the common man. And Honorable Speaker, kindly allow me to say that even in this issue of communication and disseminating information, when it comes to issues of disability, you'll find that people with disabilities may not have that information. So the government needs to put in place mechanisms to ensure that no one is left behind with regard to ensuring that information is reaching the common man. Honorable Speaker, I saw the government spokesman, saying that they're going to start a sensitization program at Mbagathi on Wednesday, and all the people who were there in attendance were able-bodied. Where were PWDs? The government needs to do something. Thank you.
Thank you, Senator. Senator Nderitu John Kinyua.
Thank you, Madam Speaker, for giving me this opportunity. And from onset, I want to say I support this adjournment motion. And Mr. Speaker, Madam Speaker, health is devolved. And this falls squarely under our mandate. And I would want to say that from what I've been reading from books and from different parts of this country, is that the number of people that have been infected by this coronavirus is more than 160,000. Mr. Speaker, 76,000 people have recovered. So my question is, as a country, if we have 76,000 people who have recovered, why don't we ask ourselves, what have those people done so that they can recover? And then we can follow up if there is a way we can, as far as we are trying to protect ourselves from this disease. And now in this country, we have got 4 people who are already infected. For those people, and we have 76,000 people in the country, in the world who have recovered, then we should know what treatment were they getting, what medical regimen were they given, so that at least we can apply that to them, and maybe that one can help us for those who are infected, Madam Speaker. And for those who have not, been infected, or we are trying to prevent ourselves, Madam Speaker, we are following what government is telling us about sanitizers, which many of Kenyans are finding it difficult to find. Madam Speaker, if they don't get sanitizer, we are told we can use running water plus soap, Madam Speaker. And I would want to say that if we follow that, Madam Speaker, and we get, we are safe, Then, Madam Speaker, there's one thing we would ask ourselves, and majority of my colleagues have been asking that question. What about those people? If we are told then we should not go where there are many people, and even I've heard that you ban wedding, you ban burial ceremonies. Madam Speaker, what about those people who are in a place like Nanyuki, whereby people live in these big slums, Madam Speaker, like a place like Riki? What do you do with those people? Because, Madam Speaker, these people live in those slums. That's where they live, and there's nothing much they can do. You go in Nyahururu, in Minor Village, these people live in slums, Madam Speaker. We should do something. If it's about these face masks we're talking about, maybe you can provide for free for those people, and that one can help them. And it's my guess, the face mask, Madam Speaker, is not that expensive. Madam Speaker, as we continue speaking as a member of Health Committee, we would maybe twice per week, so that we can get briefing from National Emergency Response Team, as well as the county response team, as we go to our counties to see exactly what is happening. Thank you, Madam Speaker.
Thank you, Senator. Senator Wambua Enoch.
Thank you, Madam Speaker, for this opportunity. Madam Speaker, I also want to join my colleagues in supporting the adjournment motion by the majority leader as amended. Madam Speaker, I want to begin by saying that the amendment has made the motion a lot more palatable. Because, Madam Speaker, as a leadership, we should never be seen or create the wrong impression that we are running away from a situation. That would have been a very, very bad message to pass to Kenyans. And as the majority leader was moving his motion, he made it very clear that as leaders, we should be traders in hope. We should speak hope to our people by the things we say and the things we do. Shutting down operations of the Senate and retreating to our counties is not necessarily speaking hope to our people. And the Milan story is fresh with us, Madam Speaker. That when people sensed that there could be a shutdown and a lockdown in Milan, more than 10,000 people left the city, and with them, they carried the virus to very many parts of Italy. Madam Speaker, in supporting this motion, I want to say health is a devolved function. The National Assembly can decide to go on recess if they must. In fact, Madam Speaker, today I was having a conversation with some members of the National Assembly, and for them they were saying that then the money for CDF should be credited to their accounts so they can go and give out bursaries and initiate developments. And I said that is fine, that we also need that. But for us, Madam Speaker, we need to be here, and we need to speak hope to our people in circumstances that are not very, very good for all of us. Madam Speaker, for the CS, I must say that so far the CS for Health has done a good job, so far. At least much better than his counterpart in agriculture, who, faced with similar circumstances, has said things that have left Kenyans wondering whether we have leadership or we don't have leadership. Madam Speaker, it has been said that there is money that has been given by the World Bank, around 8 billion Kenya shillings. It will be very important for this House to be on top of the disbursement and the utilization of these funds.
Order, member, I see. Okay, your card is back. It started from the wrong point. Okay, continue.
Thank you, Madam Speaker. I think that 1 minute will be added to my time. So, Madam Speaker, I was saying there's money that has been given to the national government to deal with this calamity. This House must ensure that this money goes to proper use. And Madam Speaker, there is a matter that has been bothering me on behalf of actually the people of Mombasa, and the Senator from Mombasa is here, and Kilifi. Madam Speaker, as a House, we need to apply our minds on the matter of the Likoni ferry. Madam Speaker, the congestion at the Olding Bay, as Kenyans cross the channel. Madam Speaker, if, God forbid, we got one person infected by this virus, and then we put them at this Olding Bay where literally people breathe into each other's mouth, Madam Speaker, we'll have a calamity of a magnitude that we cannot deal with. So, Madam Speaker, I support the adjournment motion with amendments, and this House must continue to be on top of this situation as it continues to unfold. I thank you, Madam Speaker.
Thank you, Senator. Senator Milgo, Alice Chepkorir.
Thank you, Madam Speaker, for giving me a chance to speak to this motion, and I support this motion with amendments because of the fact that this is a critical period in our country, and as leadership, we cannot afford to go and bury our heads in the sand. Madam Speaker, indeed, COVID-19 virus is actually sweeping across the whole world, as it has already killed well over 7,000 people, and it is still going on. Madam Speaker, I think this is the most important issue here is issues of control. And as I support this motion, I think the 2 weeks are enough for us so that we can come back and be able to monitor and be able to direct what should be done in the various counties in order to cap this spread, Madam Speaker. I think the 14 weeks, the two weeks is also a way of quarantining ourselves, and these 2 weeks are even biblical because issues of quarantining is very important. I think in the Holy Book of Isaiah 26, 20 to 21 tells us, "Go home, my people, and lock your doors. Hide yourselves for a little while until the Lord's anger has passed." Madam Speaker, I think by the time we come back in 2 weeks, some solution will even have been found as pertains to even how to manage. I think somebody has actually brought caution on the issue of the CS health, but I used to say that his entering behavior was very pleasant. However, he should not go and sit down, imagining that being praised right now is done very well. Worse still, Madam Speaker, is that the health workers that are in the first line in the various health units, particularly those areas where you're supposed to detect the sick or even to quarantine those people that have been declared positive for the case of this virus, should be having the right gadgets, Madam Speaker. If in this case, it will become unfortunate that we even lose one health worker, it is going to be a challenge to every one of us, to the whole country, because all other staff, health workers, will in this case be cautious in approaching even the sick people. Madam Speaker, I think this is quite unfortunate. If we are talking about even issues of gloves, issues of even masks that are missing in those particular health units, I think the CS, as a matter of urgency, together with this committee, should be able to ascertain that these particular items are provided right across the counties, because I think this disease is spreading fast, particularly because of the fact that at the course of the 14 days, when somebody has not shown symptoms, that is as a asymptomatic period, that is a time when the same virus is still spreading. Madam Speaker, in addition to this, as we look at the way of curing, quarantining, we should be able to think about those people that come from areas where we have where the inhabitants are staying in slums. I normally see a lot of people coming to town en masse. That means that wherever they are living, there are also very many, and therefore issues of food should be looked into. Issues of sanitizers, Madam Speaker, that is already jumping from just 120 shillings to 3,000. That is not acceptable, and in any case, I think something should be done in this country to actually put in place punitive measures against those people that are bringing inflation. Madam Speaker, as we continue actually facing this challenge, which is indeed is going to bring about recess, not only in our country, but even the whole world, I think we should be think about having some national committee that will think about post-coronavirus, which apart from looking at the taxes, how to stay, maybe some loans or even reduce issues of taxable amount in banks, in this case, we'll be able to see how we can bring back to our economy on the toes. Madam Speaker, finally, the issue of misinformation through the media. I think we are having a lot of issues. As I was coming to the Senate today, I was being told that 4 cases have been found in Nakuru. Madam Speaker, that is misinformation, and I wish
have a minute.
that misinformation to be checked, Madam Speaker, and in addition to that, care should be taken to avoid issues where somebody will come up and say there is cure. Like I remember the case of Loliondo, where several people were going there, and actually there was no cure, because I've already had in Liberia there are a lot of herbalists. Recently we had in Uganda, they are saying there is already a vaccine, and that will make our people panic, and some of the scrubblers people may make this a chance to make money. Otherwise, Madam Speaker, I support this motion. Thank you.
Thank you, Senator. Senator Mwinyi Haji Mohamed Faki.
Asante Mheshimiwa Spika kwa kunipa fursa hii kuchangia hoja ya kuahirishwa kwa bunge la Senate kama ilivyo karabatiwa na Senator Chilo yako. Mheshimiwa Spika, kwanza ningependa kuipongeza serikali kwa wazi kwamba janga la corona limefika katika nchi yetu ya Kenya, na kwamba tayari tuna waathiriwa 4 ambao wameweza kutambuliwa na vile vile kuwekwa katika karantini. Mheshimiwa Spika, pili, ningependa pia kusema kwamba kule Mombasa, katika kaunti ya Mombasa, siku ya Jumamosi tulikuwa na mkutano ambao mkutano ule ulisimamiwa na governor wa kaunti ya Mombasa na vile vile county commissioner wa Mombasa, ili kuweka mikakati ambayo itasaidia kupambana na janga hili la corona. Mheshimiwa Spika, jambo la kufurahisha ni kwa tayari kaunti ya Mombasa tulikuwa tumejitayarisha. Tuna vyumba maalum ambavyo vimetengwa katika hospitali kuu ya Coast General, na vile vile kuna hospitali nyingine 2 mpya ambazo zimejengwa, lakini bado hazijawekwa vifaa ambavyo zinaweza kutumika kama mahali ambapo wale wagonjwa wa corona wanaweza kuwekwa ili waweze kutotangamana na wagonjwa wengine. Kwa hiyo Mheshimiwa Spika, maandalizi yetu yako sawa, isipokuwa tuna tatizo la feri, kwa sababu kama unavyojua feri ya Likoni, kivuko cha Likoni cha feri kinahudumia wakazi 300,000 kwa siku, kuanzia saa 12 ama saa 11 alfajiri mpaka saa 5 usiku. Wanaotumia kivuko kile ni zaidi ya watu 300,000, na vile vile magari zaidi ya 3,000 ambayo yanatumika katika kivuko kile. Mheshimiwa Spika, jambo la kusikitisha ni kwamba katika feri ile, bali na kuwa kuna msongamano, hatujakuwa na mikakati yoyote ya kuweza kuhakikisha kwamba wananchi walioko pale wako salama. Vile vile Mheshimiwa Spika, japokuwa mkutano wetu wa juzi ulipitisha kwamba kuwekwe maji ya kuosha mkono na sabuni na vile vile vifaa vya sanitizer, jambo hilo bado halijaweza kutekelezwa kwa sababu ya ukosefu wa hela. Kwa Mheshimiwa Spika, ningeomba bunge hili lihakikishe kwamba kwa vile feri ni zile huduma ambazo bado ziko katika mikono ya serikali kuu, Tungeomba kwamba bunge hili la Senate lipeleke malalamiko kwa serikali kuhakikisha kwamba feri inaangaliwa kwa haraka, kwa sababu feri hili inatumika kama kiunganishi baina ya nchi ya Kenya na nchi jirani ya Tanzania. Na jana waziri wa afya wa Jamhuri ya Tanzania alitangaza kwamba ugonjwa ule pia umeweza kufika nchini Tanzania. Kwa hivyo ipo hatari kubwa ya wagonjwa kupitia mipaka ya Lungalunga na mipaka mingine kupitia katika kivuko cha feri, na pale katika feri huwa tuko bumper to bumper kama anavyosema wataalamu. Hakuna nafasi, kwa sababu kuna feri ambazo huwa zinavukisha raia tu wakati wa rush kama hivi sasa jioni. Kwa hivyo hatari kubwa iko pale ya wananchi kuweza kuambukizwa na ugonjwa huu, na itabidi serikali iangazie kwa haraka, kwa sababu hakuna haja ya kupanga mikakati mingine wakati pale ambapo ni pahali ambapo ni hatari zaidi hapajashughulikiwa. Mheshimiwa Spika, pia japokuwa tuko katika janga la corona hivi sasa, tusifunge macho kwa masuala mengine, kwa sababu kwa mfano juzi katika barabara ya Mombasa Malindi watu karibu 16 wamepoteza maisha yao kwa ajali ya barabarani. Tungeomba NTSA iweze kuangalia swala hilo, kwa sababu hatuwezi kuwa tunajitahidi tusipoteze maisha kwa corona, watu wengine wanapoteza maisha katika barabara. Asante Mheshimiwa Spika kwa kunipa fursa hii.
Asante Senator Cherargei Samson Kiprotich.
Thank you, Mr. Speaker, Madam Speaker. Sorry, my apologies for this opportunity. I want to join the rest of colleagues that extra times needs extra measures, especially when we are living at such a time. Madam Speaker, the country has taken necessary bold steps in some of these issues, and I think as a country, we need to put contingency plan to ensure that we arrest the spread of COVID-19 so that more Kenyans are not continue to be infected or affected in one way or another. Madam Speaker, maybe two things. One is that the government must come up with contingency plan, especially in the support program, especially to many Kenyans. You remember our economy is hand to mouth, and you are saying people to stay at home. We need to, as a country, maybe even have had the CS, and I think for the first time we have a Minister of Health or a Cabinet Secretary of Health by the name Senator Mutahi Kagwe, who fits the bill by even saying today in the afternoon that water that had been disconnected because of the bills should not be. And I think also the government must come up with raft of measures. Even in Nairobi, where people live in slums, there needs to be suspension of rent payment in terms of other bills, electricity, so that Kenyans do not have to worry about the monthly bill. So that, because we know these are people who will need to go to job daily so that they can be able to pay and subsist themselves, Madam Speaker. Madam Speaker, finally, the government also must agree with companies and other agencies that they must be given tax exemptions at this time of the point, so that even manufacturers might be encouraged to lower the cost of basic commodities, basic things that we need, be it soap, be it bread, be it food, so that Kenyans do not have to go on out of their way, Madam Speaker. Madam Speaker, and I think as a country, finally, I want to agree that we need to maybe take 2 weeks, recess and agree to come back in the next 2 weeks, Madam Speaker. But in my challenge through your office, you need direction from you, Madam Speaker, to guide the Committee of Health, so that in as much as Cabinet Secretary Mutahi Kagwe is giving timely updates, we need to also get an accountability in terms of not only the money that the government is getting of 6.2 billion from the World Bank, but what raft of measures are they putting in place? And I think it is very important as a country, Madam Speaker, that some of these issues, and I think as a leaders, the Napoleon, if I'm correct, say that leaders are dealers of hope. We should not appear as leaders that we are taking the back seat. We should be at the front line so that the country does not panic, so that we give hope to many Kenyans, so that Kenyans can stay at home and ensure that they bring at the end of the day. And I think, Madam Speaker, as a country and as a parliament, we also need to be operational to check. You remember the executive is now on top gear. There are many legislative and policy interventions that the national executive and even the county governments might need to put intervention. So, Madam Speaker, if all of us go maybe for recess for 1 month, for example, it means legislative and policy interventions that needs to be put cannot take place because it means we can't account these people. The transparency cannot take place, Madam Speaker. And therefore, I want to urge all Parliament, let us not just take blanket decisions in terms of recess without putting into focus the issues of legislative and policy interventions as a Senate and as a National Assembly. And I think Kenyans, and if the future generation and posterity will judge us harshly, if at this time when Kenyans need us to be at the forefront, we abdicate them when they need us most, Madam Speaker. Finally, I want to commend the President and the government that on Saturday, we are going to hold a national prayer day. And I think the nation, Kenya as a God-fearing nation, God will continue to protect us as a nation. I thank you, Madam Speaker.
Thank you, Senator Mwaruma Jones Mwashushe.
Thank you, Madam Speaker, for giving me this opportunity to weigh into this issue of, to support, first of all, the motion of adjournment about this disease, COVID-19. First of all, I would want to say that this disease is very problematic in the way it manifests itself, in that, Madam Speaker, it manifests itself in terms of cold and coughs and fever, and Madam Speaker, common cold and flu manifests itself in the same way as COVID-19. So it's a disease that gives a lot of worry to people because then you're not able to identify or to distinguish between when you're suffering from COVID-19 and when you are suffering from common flu. Madam Speaker, then it gives a lot of fear, and I would want to say that people really should be calm in that there is a slight message of hope I would want to give, that even when you have the common cold we know has a treatment and it can go. But even for this COVID-19, Madam Speaker, we're told that it's not a death sentence, in that when you have this COVID-19, out of all those people who have had it in across the world, only 10% have lost their lives and 90% has been managed, Madam Speaker. I would want to say that I'm happy that we're going to the counties, Madam Speaker, to go and see how general management of COVID-19 is being undertaken. So the motion has come in timely, in a timely manner, so that we go and monitor the level of preparedness of our counties and the national government in terms of managing COVID-19. Madam Speaker, several discussants here have said that we have 6.2 billion coming from World Bank to support Kenya in terms of managing COVID-19. I said when I was supporting the amendment to Senator Ochilo Ayako's motion that we need to have these funds devolved, and there should be a lot of openness in the way these funds will be managed. Remember, Madam Speaker, this disease will spread to our counties, and our people whom we represent are in the counties. So we need to know how much is going to be devolved and how that money will be used. But Madam Speaker, remember we have no oversight fund. So even if you were to go to the counties and the villages, it might be problematic again to move and get to know how the disease is being managed and how our counties are prepared, because then you don't have facilitation. I think because, Madam Speaker, we have money for committees to work in the counties, it's possible, Madam Speaker, that through the able leadership of the House, that we get some few shillings here and there so that we can facilitate our senators who go to the counties in terms of movement, so that we see what is happening. Madam Speaker, I also say that, I would like to say that in terms of checking in people coming from other countries, it has not been very solid, it has not been well done. When you come from Nairobi, Madam Speaker, there's a route that you pass through Kajiado, then you go to Tanzania, Tarakia, and you come back to Taita Taveta through Taveta. When you go by road, Madam Speaker, sometimes you're not checked. So I would like to say that the Minister of Health and all those people who are managing that disease should also check people are coming into the country by road, Madam Speaker. I would like to say that in times of crisis like this, the agencies that deal with water, because you're told you can manage this disease with soap and water, Madam Speaker, we should have, as Senator Cherargei said, let us have the agencies that deal with water and the Ministry of Water not maybe shutting down or cutting down water supply to markets and to houses, because then you need a lot of that water. I've seen, Madam Speaker, in counties, situations where Ministry of Trade has been denied water by Department of Water because the Department of Trade has not paid for water in markets. I think what we should do now, should have a paradigm shift where we say, let's have water supply to markets and to households, and then maybe later on, we can look at the bills later on. I think CS Mtaikagu has spoken to that, and it's something that really we should explore so that we can help our people. I thank you, Madam Speaker.
Thank you, Senator Sagaja. Johnson, other.
Thank you, Madam Speaker. Today, technology has let me down because my card was there very early, but it was not reflecting. Madam Speaker, there is a reason why Article 1 of the Constitution says that the sovereign power of the people, that the people shall express the sovereign power, address with the people. And they have two ways to express it, either directly or through the elected representatives. Madam Speaker, that is the reason why the Congress of the US has not adjourned, the House of Commons and the House of Lords have not adjourned, because it is exceptional circumstances, maybe even a state of emergency, that then people can suspend that sovereignty and leave it to other arms of government, like the military or the executive, on its own. Madam Speaker, because of that, and I will go to my reasons, even though I agreed with the amendment by Senator Ochilo Ayako on principle, I am against this adjournment of the Senate. Completely against it, Madam Speaker, for scientific reasons and for legal reasons. Legal reasons are that the people today need us more than before. These actions being taken at a time of crisis need oversight. We need to ask questions, and in many different aspects. Questions must be asked, Madam Speaker. Madam Speaker, there is no value of Senator Maruma going to walk around hospitals in Taita Taveta. Kenyans need more here to oversight what interventions are being done on the national response. It is not that there are 67 people here every day. Many times, I mean, just look at how many we are now. Many times we are much fewer. And this is the time, and I've given an example. Congress have just passed what you call the Corona Relief Bill. What legislative intervention are we giving Kenyans at this point? There is a coronavirus response legislation being debated in the House of Lords today as it has come from the House of Commons. What are we doing apart from debating, going home? In these 14 days, Madam Speaker, scientifically, and I'm glad that you're a scholar and you're an academician, scientifically, at the outset of a pandemic or a disease like this, the first 2 weeks are not the time to quarantine because the cases will definitely go up. You must wait for a threshold. And if you look at any management of epidemics such as this, there is a threshold of a number of cases that then can lead to you slowing down, scaling down, or shutting down. So in as much as I support government's initiatives, government has intervened, said what is not essential, don't do. But as I asked earlier, is representation of the people and oversight at a time of crisis an essential service? It is extremely essential. We have the comfort, Madam Speaker, here to have sanitizers, to have running water to wash our hands, to sit at social distance, to be able to address these issues. We are safer than the people we represent. So in these 14 days, Madam Speaker, what are we going to do? In fact, if Nairobi, scientifically, or in terms of a pandemic, is seen as ground zero, where there have been cases, sending 67 people to the counties is going against the whole thinking of quarantine. Because now you're going to go, maybe you're the one who has it. You're going to go infect people in Narok if you received it from here. So you're actually spreading it. And that's what happened in Milan. People moved away and they spread it, Madam Speaker. Madam Speaker, lockdown is done when a certain level, a mathematic level of infections occur. And there are many illustrations that we've seen internationally. For now, Madam Speaker, that sovereignty of Kenyans needs to continue being exercised. We need to ask questions. Madam Speaker, is there an economic stimulus that we're thinking about? Because there are people who cannot, are going to be affected right now. Can we talk about, our Finance and Budget Committee, if they were working, and the National Assembly, they would think about halting some of these taxes on certain essential commodities. That is the work we should be doing now. Madam Speaker, at this point, we should be talking about the proposal that was given on cashless transactions. by the government. How are we going to sit down with Ukuri Atani and the central bank to say, okay, how do we effect these cashless transactions for the next 1 month? That is the work of the Senate. That is what we need to be talking about, Madam Speaker. Cushioning the poor in informal settlements. My Nairobians cannot have the luxury of, Madam Speaker, having social distancing in bus stops, in Marikiti, in a bus station, at Kencom. Go right now and see. We should be talking about now here how we address that, Madam Speaker. And many things, public transport. The Transport Committee should be talking to the Kenya Ferry Service and talking to commuters and operators of matatus on what they're doing, not us going on a break. This is not the time to go on a break. Madam Speaker, we must give Kenyans confidence and tell them the truth. Statistically, the cases will go up. We have only just gotten 4. In fact, when we come back from this 1 or 2 weeks, there'll be more cases of corona. That is the time we should be going, not now. We should be going then when we've already set down measures and an accountability mechanism and a reporting mechanism by the ministry. We have looked at these economic issues, looked at the social issues, then we can say, okay, now we can hold back for 2 weeks because the cases have reached maybe 100 or 50. Of course we pray. Saturday we're going to be praying for this country that the cases don't. But statistically, Madam Speaker, you can't reinvent this thing. It is bound to happen. The 23 who came from the plane and were quarantined, fortunately, they have been proved negative, but we must give reality. The reason Kenyans are saying Senator Mutai Kagwe is doing a good job is because he's being honest. He's being honest, he's communicating. Madam Speaker, panic, like what we're doing today, panic is when you act without sufficient information. How then will we get information on behalf of Kenyans while we're on recess? Madam Speaker, with those many remarks, I choose to still, I know I'll be possibly even the only one on record because everyone is supporting and will vote, but I still think this is not the right move to make. It is a move made out of panic. Let us have Kenyans who are not delivering essential services work from home. We cannot legislate from home. We cannot bring intervening measures for this country from home. We cannot talk about how to cushion the poor people in different parts of this country from home. And Kenyans need us now. A general does not run away at time of war. A captain is not the first to leave when the boat is sinking. In fact, that is the time he helps everybody else get out of the boat when the boat is about to sink. We can talk about, the measures done in House of Commons and Congress. Restrict visitors. Close the catering unit in the Senate. Tell people, for instance, my office, Madam Speaker, because they are not, my officers are not exercising sovereignty in my office. I have given them, shifts so that they don't come to the office. They don't come to work. I have now skeleton staff, the very essential that I need. Maybe just a driver and my PA. That is enough. But for us who are here on behalf of Kenyans, if you're not here, Senator Ledama, people of Narok will ask. And if you go to Narok without information, are you adding to the solution or to the problem? Madam Speaker, I oppose. Thank you.
Thank you, Senator. Senator Wario Golit Juma.
Asante Bi Speaker kwa kunipatia nafasi. Nami nasimama kuunga mkono mswada na hasa mabadiliko yaliyopachikwa na Seneta wa Migori. Madam Speaker, kwa kweli ugonjwa wa corona vile ilivyotangazwa kote duniani, hapa Kenya watu wamepata wasiwasi mwingi sana. Kuna uvumi nyingi inaendelea hapa na pale. Mimi nilionelea mwanzo Seneti isiakhirishe vikao zake kwa sababu wananchi wa Kenya wako na imani sana na bunge ya Seneti, na wanapoona bunge ya Seneti inaakhirisha vikao vyake watakuwa wanatatanika na kusema kwamba hofu hiyo itaongezeka maradufu. Kwa wakati huu ambayo tunaenda nyumbani, hata wale ambao wako katika makaunti ambazo sisi tunarudi, wanajua magonjwa bado hayajafika huko Taita Taveta, haiko Tana River, haiko huko sehemu za chini. Lakini habari wanapata ni ya kwamba huko Nairobi ndio watu wamepatikana wako na hiyo magonjwa, hasa wale waliosafiri kurudi pande huu. Na hasa huko Tana River, watu siku hizi huulizana ni watu wangapi wametoka Nairobi. Na hasa sisi pia tukienda tukiongezeka pande hiyo watasema nyinyi ndio mmetoka kwa sehemu ya magonjwa. Lakini kwa vile mswada umetolewa na pia mabadiliko yamewekwa kwa hiyo mswada, sina budi kuweza kuunga mkono mswada uliowekwa na seneta rafiki yangu, Seneta wa Migori, Achille Oyako, tuweze kwenda kwa majuma mawili, na pia tukirudi katika hizo majuma mawili mengine pia tuweze kukaa kwa siku moja ili tuweze kuongea mambo ambayo yanayojiri. Kwa kweli, kama leo hatungeweza kuahirisha makao yetu, kungekuwa tunafuatilia wale wenzetu ambao tayari wameambukizwa, kama idadi hii itakuwa inaongezeka au kupungua hata kwa wale ambao wako hospitalini, ambao tunaomba Mungu sana hao pia wapate afueni ya haraka na kuweza kutoka katika sehemu hiyo. Kwa hivyo Bi Speaker, wakati huu ambao tutaenda nyumbani, tutaenda kuangalia, tuweze kuona mikakati hasa yale ambayo yako katika kaunti ambayo yanaweza kusaidia kupunguza uambukizaji zaidi ya wakati ambao sahi tunaweza kupata. Madam Speaker, ninaunga mkono. Asante kwa kunipatia fursa hii.
Asante Senator Mbogo George Ochilo Oyako. Finally.
Well, thank you, Madam Speaker, for giving me an opportunity to speak to this motion. Madam Speaker, the religious say that do all you can to protect yourself, but seek the protection of God and all will be well. I am glad that as senators, we are doing as best we can to ensure that this institution outlives us. We are receding or recessing for 2 weeks so that measures can be put in place to ensure that we continue functioning. We are not running away, we are not hiding, we are ensuring that the institution is safe, we are ensuring that humanly possible measures are being put in place to ensure that our continuity is guaranteed. And I think that is a sensible thing to do. That's a reasonable step to take. Otherwise, we would be a reckless institution. But to extend it for a month would amount to abdication. We are asking first responders, we are asking doctors, we are asking security personnel, we are asking airport personnel to be on duty 24/7. They are exposed daily. They are daily in constant touch with the people who are having this disease. And if we are asking them to be on duty, we must equally be on duty to give them support and also to get feedback from them and ensure that their support is guaranteed and that all systems are putting in place mechanism to ensure that they work and they continue working. Madam Speaker, there are two things about coronavirus that we must think of. Many people here are talking about physical death. You cannot run away from physical death. In fact, it is possible that within the 2 weeks, we will lose one or two of our loved ones, or even ourselves. It is possible. We cannot prevent it. That is what is logically possible. We cannot prevent it. So let us not think that even these measures we are taking or putting in place is going to guarantee that we don't die. In fact, I wonder what kind of life we would have if we didn't die. We must die and venture into more adventurous life in heaven. I'm told it's so beautiful there. And you can only get there if you die. So dying, we will die. And let us do the best we can to make peace with our Maker so that when we get to the other life, we are not rejected or condemned to purgatory. We are welcome to heaven. So the other thing about coronavirus is the economic death. There are Kenyans out there who are living from one paycheck to the other paycheck, from one wage to the other wage, from one shift to the other shift. These Kenyans are dying and nobody is speaking about them. Nobody is representing them. They don't know what they will eat tomorrow if we were to shut down this economy. Those are the Kenyans that we must be available here to think about them. They may not physically die of coronavirus. I don't even think coronavirus will kill all Kenyans. But if these Kenyans do not eat, these mama mbogas, these omena women, these border people, this fishing community in Migori County are going to die if the economy is shut down. So as responsible leadership, As we pretend that we are able to stop physical death, what are we doing about economic death of our people? Because our people will die economically after surviving corona. So it's important for us to meet once a week and think of our people, think of what we will put in place to ensure that beyond physical death, as they still traverse the earth, they are able to survive economically and are able to contribute to the growth of this economy in a positive way. So, Madam Speaker, I am very happy that we have finally reached a compromise to look after our own safety, but we have also given opportunity when a time arises to think of our people beyond the physical death that we cannot prevent. Some will die, some will suffer in hospitals, but economic death because of shutdown is facing all of us. It is facing everybody. The matatu industry has been hard hit. The hospitality industry has been hard hit. The laborers who work in hotels that have been shut down in Mombasa, they are being shut down in Nairobi. What will their children eat? And all the children at home, you can imagine.
Thank you, Honorable Senators. Pass one to Standing Order 58. 59B, 5952B. I have received communication from the leader of majority who was supposed to respond to, who was the mover who was supposed to respond. He has handed the same responsibility to the Senator of Narok, Senator Ledama Olekina.
Madam Speaker, on behalf of the Majority Leader, I'd like to thank all the senators who spoke very passionately on this matter and who supported the adjournment motion. This, Madam Speaker, is a very important thing as we have one of our colleagues sneezing. I hope you didn't travel yesterday. Madam Speaker, all the senators spoke very passionately about wanting to see a very careful approach to dealing with this pandemic. Madam Speaker, the senator spoke about the need for the government to invest heavily on the issue of testing kits. This is very, very important. One of the things that concerns me is that as the parliament in this house, in this country, we are the ones, and as senators and also members of the National Assembly, we traverse the whole world trying to learn more on how best we can be able to improve on our legislation framework. And Madam Speaker, by doing so, we don't go there and stay by ourselves. We go there and we meet with other legislators, or we meet with other people. And doing so, we actually put ourselves at risk. And this 2 weeks period will give us an opportunity to really give our employer, who is the Parliamentary Service Commission, an opportunity to be able to come up with serious mitigating measures that will ensure that we ourselves here are safe and the people that we represent are also safe. There are key issues that have been spoken about that I want to reiterate in my reply, Madam Speaker, which has got to do with the issue of the economic stimulus. Madam Speaker, Senator Sakaja asked various pertinent questions about what is it that the national government is doing. Are we talking about coming up with a stimulus package? Other senators spoke about money that is being given to this country by the World Bank, about $6 billion. Madam Speaker, I would like to call upon the national government through the Ministry of Health, which I'm very, very happy with the work that Senator Cabinet Secretary Mutahi Kagwe is doing, to consider giving a stimulus package to all the 47 counties. If we were in a position where each of the 47 counties can be given $1 billion shillings so that they can be able to help that economy grow, we will be able to help the mamamboga. We will be able to help the people who work in the constructive sector. We will also be able to ensure that everybody get tested. It is very sad, Madam Speaker, that all of us are here, having interacted recently when we came back from Mombasa with other senators who traveled And now that I hear they were in the same flight with some of the members who are confirmed to be positive, yet we do not have testing kits. So this issue of testing kit is something which is important, and I think the only thing that this government can do, even calling for, even setting aside, or rather proclamation of a National Prayer Day on the 21st, is to invest more money on free testing kits, and really good testing kits that people will not start selling fake testing kits. Madam Speaker, it is also important that during this time, the Ministry of Treasury and also Central Bank come up with measures which will ensure that the perpetual motion machine, where we spend, we pay money, that money is used to be able to pay taxes, to pay for doctors, to pay for the police, that motion still continues. Because if we don't, and we panic, then it is going to affect the way we grow as an economy. Madam Speaker, one thing is very clear. This virus is spreading rapidly, and senators taking some time off, 2 weeks, to be able to go, and actually nothing stopped them from meeting with the cabinet secretary privately, so that they can be able to hold a press conference. I'm sure Senator Sakaja would be able to do that, because I'll be concerned. Because, Madam Speaker, Nairobi, when you look at the slums, and this is why sometimes, Madam Speaker, when we talk about land use policy, we try to educate people on the dangers of people living together, so many. In fact, there are some places in this country, Madam Speaker, that when you go to, in this capital city, like Mukuru Kwanjega, you will be shocked. If one person is to be infected with that virus, I'm telling you, the number of people who will be infected, this country will not be able to manage. So this period, when we are going on recess, it will give us an opportunity, because even for us, as senators, we spend a lot of time with our electorates, our constituents. When we go out there and we hold public barazas, if some of us are infected, we will be able to infect our entire constituents and will not be able to control. This virus is spreading rapidly, but instead of being scared, instead of panicking, it is important to give us an opportunity to sit down and evaluate yourself. Senator Orengo spoke about when you enter the plane, you are told, in case of an emergency, you first of all ensure that you buckle up, and then you put on your seatbelt before you can be able to help another person. Number two, if there is anything to do with those oxygen masks, you put on that mask so that you can be able to help even your own child. So these 2 weeks will give us an opportunity to be able to go back. Then on the 31st of March, come back, and then continue holding sittings once a week to be able to ensure that we are safe and also the rest of the country is safe. Madam Speaker, I want to talk about in the issue of psychological effect. Earlier on, most senators also spoke about the post-traumatic
just to
stress
bring your
disorder.
attention, Senator, you have 5 minutes.
I've seen.
Yeah.
Yes.
Okay.
I've seen
I just wanted you to be okay.
Thank you,
with
Madam
that,
Speaker.
yeah.
I've seen the time. I'm very, very cognizant of the time, but I thank you. Just in conclusion, really, I just want to encourage the Ministry of Health to be able to come up with training on how these medical personnel in these hospitals can be able to deal with the issue of psychological trauma, like the post-traumatic stress disorder. Because some people, just because of stigma, or people, if they are diagnosed, and currently we don't even know how many people are being diagnosed, but if anybody is suspected of having been infected with this coronavirus, how do they deal with that issue of, what do you call it, self-quarantine, which now the Cabinet Secretary has said it is a law. If you do not self-quarantine, then you face the risk of going to jail. So, Madam Speaker, as I finalize, it is important for us, as we go back into our constituencies, into our counties, to go and educate our people. There are some of our people who have no clue of what is happening in Nairobi. They hear of this coronavirus, you go, they say, what is this coronavirus? So this will give us an opportunity, regardless of whether we have an oversight committee, to be able to go there, take some time. Let us set our political differences aside, sit down with these governors, share with them our ideas, go down into the markets, educate the people, make sure that the Ministry of Health can be able to produce and ensure they distribute a lot of sanitizers. If there are no sanitizers, do what this company has done today. And I want to recognize them because of what they have done. I think it's called Pony Oil. They have reduced the cost of soap and cooking oil. That shows that they care about the people. So what we can also do is to go there, spend the little money we have, buy sanitizers, put some soaps or washing basins outside markets, because our people have got to continue earning a living so that we can be able to help them. That the most important thing is for you to stay healthy, for you to stay clean, improve your hygiene. So, Madam Speaker, on this, I beg to reply.
Honorable Senators, I would now like to, as was determined earlier, it doesn't concern counties, so we will approve the motion by acclamation. Honorable Senators, I would now like to put the question that aware that coronavirus disease, COVID-19, a new strain of coronaviruses that was discovered in December 2019, is an infectious disease known to cause respiratory infections ranging from common cold, fever, tiredness, aches, and pains to more severe health complications. Cognizant that this epidemic has no known cure and has spread and killed many people over several countries and continents with the potential of affecting a large percentage of the world population as the impact of the virus is still unfolding. Further, cognizant that the World Health Organization has declared the coronavirus disease, COVID-19, as a pandemic, aware that the government, upon confirmation of coronavirus cases in the country, has taken various measures aimed at containing the spread of disease, including suspension of learning in all education institutions and the need to minimize attendance of the various gatherings, acknowledging that Parliament buildings has high human traffic on any given working day, including members of Parliament, staff, visitors, school children, visiting delegations, and witnesses appearance before House committees, given the need for Parliament to institutionalize measures to mitigate the crisis posed by the virus, further recognizing the mechanism set out in the Standing Order 30 to convene a special sitting of Senate. Now, therefore, notwithstanding the resolution of the Senate made on the 27th February 2020, pursuant to Standing Order 29, approving the Senate calendar, and owing to the need to complement the efforts of the government in containing the spread of the disease, the Senate resolves as follows: to adjourn its plenary sittings today, 17th March 2020, for 2 weeks, so as to reconvene on Tuesday, 31st March 2020, and to thereafter hold one sitting in each week on Tuesdays for 2 weeks until Tuesday, 4th April 2020. Will as many as of that opinion? B. And B, alter its calendar accordingly. Will as many as of that opinion say aye? Aye. Will as many as of the contrary say nay? The ayes have it. Honorable Senators, have a communication to make, therefore. Honorable Senators, following the resolution of the Senate that has just been concluded, I now direct that the sittings of the committees also shall be suspended for a period of 2 weeks, after which further directions will be given by the Speaker. I thank you. Honorable Senators, having concluded the business of the day, it is now time to adjourn the House. The Senate therefore stands adjourned until the 31st March 2020 at 2 p.m. 2:30 p.m.